Welcome, everyone, to tonight's Midnight Ranting. Should trans children be allowed to take puberty blockers? We like to keep it light, where we talk about the sensitive subject of gender dysphoria, pills, and parents trying to do the best they can. So come to join the skeptic crew for some gendered fun. I want to thank you all out there on the inner tubes. We're a skeptic channel, but after the host openers, we'll be opening up the floodgates, or rather, the open mic, meaning anyone can come join us and say what's on their mind. Atheist or theist, liberal or conservative, come as you are, just on the sheets.
Come on.
If you're feeling fancy, don't forget to like, follow, or subscribe. And don't forget to set that bell icon to all so you can see our premieres or join our live streams. You can also support us making more content by heading to the link at patreon.com/Amy Newman, including awesome Patreons like, and I'm going to interrupt myself, I don't have my wonderful props tonight. My computer took a crashy crew, but that's okay. We're still having fun, including awesome Patreons like K.O. Champ and Oz from the Atheist Round Table and Network.
Frying pan in her hand.
Exactly. Just imagine it. But also, Diana Smith, the princess. Thank you so very much, Diana. But also, Ian. Thank you so much, Ian. Woo-hoo.
Thank you.
And also, Pat, going back in time, we are opening up the Bible. Thank you so much, Pat. Pat Lowinger, woohoo! Thank you so very much, Pat. And also, we're moving down the skeptics. Dale Pastel, thank you so very much. I'm still smoking my pipe. But also, the lead hyena. Thank you so very much to Scott Duke. Woohoo! Thank you, Scott Duke. Woohoo! But also Dave Gar. Thank you so very much, Dave Gar. I'm riding a pony right now. Just pretend, or a motorcycle, either one. And last but certainly not least, Regos. Thank you so very much. Woohoo! Thank you so very much, Regos. And with that, should transgender children be allowed to take puberty blockers? Well, I don't think young children need puberty blockers. Should teenagers who are suffering from gender dysphoria be allowed puberty blockers? Well, if the doctor thinks they are appropriate, then yes, I do. That's because puberty blockers allow children suffering from the onset of gender-related issues to mitigate problems as they arise. Puberty blockers are a safe way to give these teens more time to think about who they are as a human being without taking any dramatic steps that could otherwise be harmful. However, an adolescent is still a child. I'm not making the claim a child is wise enough to make important decisions on their own. The parent, and just as important, the doctor, should be working closely with the child to figure out what is actually going on. Is there some other underlying cause beyond gender? If so, we should try and eliminate these causes. The focus of a psychiatrist or any mental health professional is simple: making sure their patient can function happily in society. Currently, puberty blockers are one of the safest methods we have for treating those who suffer with gender-related mental anguish, who are coming to their parents and professionals in pain, as everything in life, the issue is quite situational. However, with a moderate approach, with a base in science,
Yeah, get that ass.
sharing. It's lovely. We love sharing. However, with a moderate approach, with a base in science, we can make sure every child feels welcome in their body. Thank you. And woohoo! All right, James, how are you doing tonight? And are you ready for some gender-related fun?
I am ready. I think I'm ready. I'm not sure, but we're gonna do. We're just gonna do it anyway and see what happens. But so yeah, I got to catch about half of the debate. I was at work for the debate, so I didn't quite get to catch it all. But I'm going to make some comments about what I saw. So, any medical procedure, any medication, there's always going to be risks associated with that. There's always going to be side effects with medicine, and no system made by humans is ever going to be foolproof, perfect. It's not going to work every single time. And this is something that we have to deal with as people. Back in 2013, when I was diagnosed with a spinal tumor, and they came to me with the options and say, well, even if it's not cancer, we leave it there. You're in a lot of pain now. The pain's just going to get worse. You have neurological problems now. Those will get worse. And on top of that, eventually it'll just get bigger and bigger and bigger, and it'll paralyze you below the tumor. On the other side of that, well, there's risks associated with surgery. Anytime you're going in and messing with the spine, you might be paralyzed right away. You might have even more serious neurological functions, and you have to weigh the options and make the decision that is best for you. There's no guarantees in life, but you talk to your doctors, you talk to your family, and you try to make the best decision that you can, taking all the information into account. And what I see from the other side on this issue, and not just this issue, but others too, but in particular here, is a very cavalier, a very indifferent attitude in regards to the suffering of others, be it physical suffering, be it mental anguish, emotional distress. It's just not important to them. They don't care because, it's nothing that they've ever personally had to deal with. They happen to be born in a body where their biological sex matches with what they feel. That happened to me, but that doesn't happen to everybody. There are people who have these issues, and these issues even arise in childhood. I think you would find most transgender people today had known from a young age, from childhood, that there was something different about them. There was something that it's hard to describe, but kind of feels like you're in the wrong body. Not exactly, but that's how they say it. And I think you have to treat people with empathy and compassion and try to do things in a way that minimizes unnecessary suffering and unnecessary risks. And like Amy said, these puberty blockers, these hormones, they are reversible. It's not going to cause typically any long-term lasting damage. And I think our doctors do a pretty good job of assessing risks and getting these medicines to the kids that really need them. And But then again, no system is ever going to be perfect. There will be kids who get it who don't need it. But that's not an excuse. That's not a justification. Tell the thousands of other kids out there that do need it, well, I'm sorry, you can't get it because, we're not really sure if you're really sure that we're sure that you're trans or that you really have gender dysphoria. So suck it up and move on. And, that's what I know. I didn't hear religion in this debate that I listened to today, but I can't help but feel like the stench of religion all over this argument. And it just seems it's like the flat earth debates. I mean, 90% of them, if you really press them, they have religious motivations for what they think, for their views on geography of the earth, the shape of the planet. But they don't come out and as that and use that typically as their main arguing point. They come out with their misunderstanding of basic science, showing how they really just they don't know a whole lot of science and they're misapplying it, so they're getting the wrong answer. But a lot of times they're pushed in that direction from religion. And we have to realize it was not long ago, really wasn't that long ago, that the standard line of treatment for something like this was if your child comes to you and they are having gender issues, where you would look at you like, never ever say anything like that to me again. I don't want to hear it. You're born with a dick, you're a guy. If you're born with a vagina, you're a girl. That's it. End of it. Case closed. I don't want to hear anything more about it. And then every time they exhibit a behavioral trait that does not correspond with their biological gender, beat them, hit them. And then that way they will learn that those behaviors are unacceptable and they'll do less of them gradually and the problem will resolve itself. And that is, unfortunately, I think, where most of the people on the other side want to get back to that. They don't view this as a legitimate condition. Most of them view it from a religious standpoint as evil, sinful. I don't know. I mean, their God apparently designed human gender, so he designed it so you could have this disconnect between your biological and how you feel on the outside. But that's how he did it. But, intelligent design, I guess. I mean, yeah. So we don't want to go back to the religious approach, but that doesn't mean that we want to go off the other side of the deep end either. We need to have rules, regulations, and we need to have thoughtful treatment of these children. You would never want to have a parent come to a doctor, a pediatrician, and say, well, my daughter, she's always been kind of a tomboy. She's always been a little rough. And she's 7 years old now. She says she doesn't want to be a girl anymore. You would never want to take that and say, oh, right, well, let's start her on these medications right away. You wouldn't want to do that. You would want to give it time to see if it goes away or if it's actually causing the child any type of mental difficulties. If it's harming the child that they're not getting this treatment, then there's really no reason that you would want to withhold it from them unless you're just being an asshole. And I think that's where a lot of these people on the others, they don't really care about these kids. They don't care about they don't care about it. They just want people to they want to have their 1950s version of gender, and that's it. They don't want to hear about it. They give no fucks if you feel like your gender doesn't correspond with your biology. They don't care. And they would like for you not to care too. And yeah, but I thought Amy did a good job in the debate that I saw, and I would love to hear what everybody else has to say.
Thank you so very much, James. And yeah, I want to talk about a few of those, and then we'll open it up to the open mic.
Absolutely.
So if you have something that you want to say about the debate or the topic, I'm going to be sending the link in chat in a moment.
Tacos.
And tacos, I know, a normal thing. Always open to that as well. So what? Just very quickly, what did you think of the overall debate?
I felt like you did a good job. I felt like the parts that I saw, he didn't come across as like some kind of extremist, which was good. But then again, like I say, you never really know what these people's motivations are. They don't usually wear it on their sleeve if they are a religious zealot or if they really just don't like trans people in general.
And the funny thing is, you bring that up, the people, it's just like, and I hate to do them wrong, but just like with the flat earthers, they never talk about religion.
Yeah.
They only talk about science. They're only there, and they also sound very technical. Yes, a lot of times.
Yeah.
But it's only when you push them a little bit, when you try and like pop that bubble from the religious angle, that they go, oh yes, of course. Now, like I said, he's a politics guy. I think I checked out his channel. Just like he was joking, I think at the end, he said, you're more of a religious person. He's a politics person. But I do feel that this is, like you were saying, one of those where religion affects the politics, where it oftentimes makes it a lightning rod when everyone should be kind of just chill and trying to figure out what the best options are.
Right. And like I am far from the wokest member of the atheist community. In fact, I'm more conservative on some issues than most of them. But this issue, there's human empathy, human compassion. These are just kids trying to figure out where they fit in the world. And you want to step between their parents and their doctors and tell them they can't get this treatment because you don't think it's a good idea. Get the hell out of here. Fuck yourself.
And yeah, that's the real crux of it to me, is that it's really, like I was saying earlier, this trifecta of it, the kid comes to the parents, but then the parents go to the doctors, and all three of them are trying to figure out. It's not, because I saw a lot, I feel like I did well. I didn't want to look at chat too much, at least in that angle. But, a lot of people say, well, why don't you just let kids, doesn't want an arm, why don't we just chop arms off? Because that person actually has something wrong that actually does need something checked out. They need some sort of other mental help, and it is not the same. The fentanyl, the trying to take your arm away, it's a false equivalency. It would be like as if I was trying to push surgery on transgender kids. That is the exact opposite. I want, like you were saying, as I've said, more a moderate approach.
Like you're wheeling 10-year-olds into the operating room and telling the doctors to just go to town on them. Yeah, which is not what almost anybody wants.
I mean,
we want a thoughtful evaluation of the condition by medical professionals. You would want a pediatrician. You would want them to talk to a psychiatrist who specializes in children, probably with gender issues, and make a determination. You don't have to do anything right away. You would normally you would want to give it time and then make that decision when you have to, before puberty starts, because like you said, some of these changes are lifelong altering changes to the body. And that can be very distressing if your body is going to be changed in a way that you don't want, that makes you feel like your body is even less like you anymore. And I've talked to trans people, or people who would like to transition, but they don't go through with it because they feel like they look okay with their current gender. And if they were to transition, they wouldn't fit the part. They wouldn't be, a decent looking woman or a decent looking man. They just stay where they're at because their body has been altered in this way. And some people aren't into the whole having multiple surgeries and spending thousands and thousands of dollars to that. But that's what the other side wants. They would love for people. They don't care what makes you not transition. If you don't, okay, whatever gets you to stay the way you're at, don't care,
And it's a double-edged sword in that, like, it's a double-edged sword in that looks, he was I don't want to say he was trying to trivialize looks, but like they care about, and I generally mean the social conservatives, care about and judge looks very harshly. And so does society. As someone who's seen both sides, as when I didn't wear my makeup and when I did, society just treats you nicer. It's just a fact. And the people that get all the shit and they're writing all these blogs and stuff, it's because they have a harder time assimilating back into society. And just all the crap that you associate with being transgender, so much of that is cut away if you could cut that early on.
No, I mean, you got
Transition
it.
is much less painful. It's easier, less expensive, and at the end of the day, they don't care about any of that. They would like for fewer people to transition because they just don't want to see it. They don't think it's legitimate. If you're born with a penis, you're a guy. Whatever. Don't care if you don't want to be a guy, you're a guy. That's it.
In fact, and so I have the link typed out. I'm going to send it into chat in a second. But I thought he was actually going to bring up a point like, why is there more now than ever? And I feel like we're at a pendulum thing, whereas before it was so stigmatized that no transgender person could come out.
Right.
Now it is very, I don't want to say very supportive, but it is getting more supportive to be transgender. And so that pendulum is swinging. And so what I think will happen is you'll see an uprise of these, what we're calling transgender children. And then I think it will just even out. It won't, where it will be the actual number and you will see that consistent for a long time. I could be wrong, but that's what I think is going to happen.
You will have, once it becomes like not such a novelty, you will have fewer of these kids thinking that they might be trans when they're not. And when he mentioned that statistic that like 77 to 96%, I can't help but thinking that that is not the percentage of kids who take puberty blockers or transition. Maybe that might be the raw number of kids who have ever said anything about their gender. Maybe it just lasted a month and they went away, but they would, okay, well, he said something about gender and he doesn't want to transition, so he's not part of the case. But that just goes to show that the medical community is actually pretty good at screening through and trying to weed out the people who are just going through a phase.
Exactly, which is what we are trying to eliminate. I would say I don't want people, and I'm sending it right now. So we'll go into open mic in a little bit, but if you'd like to join us, you can start now. But the whole idea is that we are trying to eliminate, I don't know, false positives, whatever you want to call it. I know it's a triggering subject for a lot of transgender people, the X-trans, but I'm fine with it. Look, I just want people to feel good. I don't care if you're trans, X-trans, biological transgender, like I said, atheist, theist, liberal, conservative. I love everybody. I just want people to feel comfy in their body. If that is the goal, then we are getting there. And okay, I'm gonna maybe do one more point, and then I see a whole bunch of people joined.
So they are, but like I said, I just detect a cavalier indifference from people that it's like the way the suffering, the mental anguish, the real human toll that these has. They don't really care about all that. If we have to deny 1,000 kids puberty blockers that would need it, that would benefit from it, to save one child who might get it but didn't need it, they're fine with that. Great, yeah. Make 1,000 suffer to save that one because they don't really want them transitioning anyway.
And that's what I really wanted to understand. I feel like he wasn't taking him having a transgender child seriously until he got pressed on it, and then he gave me like a quick answer, but I don't feel like I don't feel, it wasn't lying, but I don't feel, like I said, it goes all back to empathy, is that I just think it's very hard. It's easy to sit there and just be like, this is, I'm against this until it's your child. And then your child is staring you in the face. And then it doesn't even matter about your political views anymore. Now you have to figure out what to do with your kid.
I think people from that religion would look at those guys as bad parents, that they're not strong enough to instill the correct moral values in their child, that they're just letting them be this degenerate pervert, freak by wanting to transition. But when it does happen to them, hopefully they won't treat their own kids like crap that they're so indifferent about having other people's kids treated like.
Exactly. Hopefully they then get empathy. But that sometimes happens. You see that when a kid comes out gay or something like that.
Yeah, it does happen. And yeah, we've all seen the videos where the kids are relieved that their parents are like, yeah, well, it's no big deal. I said, of course we still love you. You're my son. You're my daughter. What is there not to love? You want to be with a girl. That's not any reason to stop loving your child. And again,
Exactly.
their God is the one who designed human sexuality so that it could be wired for people to be attracted to the same gender. That's intelligently designed by God. So if you think he's the one who designed humanity, then take it up with him, because he's the one who made it so that could be a reality.
Yeah, he's the guy who supposedly makes perfect children, perfect everything, right?
Right.
And then there's this one thing. Though I guess if you're, Milo, I guff, yes, you can.
How long do you think before he's back openly?
Until it stops making money, and then he'll have to go back.
I mean, if you have to have like a counter days of days without sodomy, like...
Oh, no, that's been violated since the second day that he said he was straight, but that's a different question.
Oh my
I mean,
God.
if you've got to keep track of how many days it's been since you sucked a thing, then, yeah, it's probably not going too well for you.
And it's those provocateurs. I mean, that is just the provocateur name.
It's been 2 days and I'm doing fine. I'm not thinking about it. I don't want to go do it. It's not a problem for me. I'm super straight now.
Exactly. Which is the debate I thought I was going to have. But this is a good debate, too.
Don't look at my phone. Don't look at my phone. No. Don't look at that.
No.
Turning the frogs gay.
I'm so straight, I transcended straightness onto this.
Turning the frogs browser gay, and the radical socialist left putting these tranny porns in my phone to make me look like I'm gay.
It was the CIA. They planted the tranny.
Exactly. The tranny porn, yeah.
Okay. We're almost we'll go back to being serious. Though it all wraps together. It all wraps together, folks, unfortunately. And okay, I think Ogre said he had to leave. I actually want to say hi to Will, Cerberus, Ogre, Leophilius, Marshall, and Amaretto.
We got a whole packed house back there.
The whole crew. But Ogre, how are you tonight? We are Midnight Ranting. Woohoo! On should transgender children should they be allowed access to puberty blockers? What are your thoughts about the debate, the subject, or anything we've been talking about tonight?
I watched by the last half of the debate, like James did. Enjoyed it. I was pleased that the chat seemed interested in the conversation more so than just attacking the audience, which is an uncommon thing for MDD debates. I don't know if I'm misconstruing the sides, but it kind of seemed like a pro-choice versus not pro-choice conversation, wherein your argument was the doctors should be able to use this, and his argument was the doctors shouldn't be able to use it, which seems like an odd, well, again, seems like that pro-life argument where we should tell the doctors what to do instead of the doctors knowing best. Mm-hmm. I don't know if I'm misconstruing his statement, but that's kind of how it seemed. Like, let me read these journal articles. Apparently your doctor doesn't know this stuff.
I mean, yeah, I guess he could look at it that way. I don't think he is an educated medical professional, a psychiatrist. I don't think he's a pediatrician. So, yeah, I don't think he should be in the room when the parents and a child and a doctor discussing what they should do about the gender dysphoria.
Yeah, that's the way I took it. I was having flashbacks to the abortion conversation doing this, and those are, I'm sure, very linked. I doubt there's many pro-lifers who are also pro topic that was discussed tonight, right? But
There are
and then-
some.
well, I'm sure
There are
but-
some. Yeah.
And then I guess my third point is this is again one of those history will pass it by conversations as society becomes less scared and less afraid of the different. People aren't going to care that much. It's a shame that we're probably a generation or two away from it, but this is what having the gay son was in the 90s. That's this conversation now, and it's good to get the ball rolling on it.
Yeah, I agree with what you said. It seems to. My problem with a lot of what he says is they seem to take something that has like a nugget of truth, and what they do is they almost create a narrative around it. Like, it's true, no pills don't have side effects, and it's true you need to make sure your bone density and everything is good. But as far as pills go, like pills that everyday people take, puberty blockers are one of the safest pills out there. And so it's like, I don't know how to make it any safer except to make it water.
I mean, I think it sounds like sort of like the creationists, like how they go through real scientific papers and then they pull one or two things out of there that they really don't understand, but they can make it sound like they understand it. And it sort of backs up their point, even though it really doesn't.
Yeah. To me, it's very much, I guess has this, as you said, story concocted in his head that some doctors going to start throwing these pills at children to make money because that's the best way to turn a bankroll when you're a doctor, as opposed to the doctor actually caring about the patient. And I guess he's trying to like fight this imaginary bad doctor in his head. And it's
these doctors that want to turn all the kids trans. They want to make them all transgender.
Like you're gonna
catch these pills out like candy.
Again, I'm having flashbacks to the gay panic of like the 80s and 90s, where you're gonna catch the gay and all these other things, and
because only gay people get AIDS. You don't want to get AIDS.
Exactly. It's a rehashing of these same talking points to me, and you can flash this stuff all the way back. This exact same conversation has came at us from conservatives since interracial marriage, and further back to marrying the Irish and all these other things.
Well, back like in the 90s, they used to say like, why do they call them gay people? Because they're so unhappy. Look, their suicide rates are way higher than the heterosexual community. There's something wrong with them. They're mentally ill. They need our help. It just sounds like they don't really care about them. They just want them to stop being gay. But
yeah. And I guess that's all I got. If I just drop out, it's because I'm tired. I'll try to stick around to listen. But if I'm not gonna need an outro, just so you know.
That sounds good. Thank you so very much.
We'll send you to the Otangelo room.
Oh, thanks.
We'll have a role play. And okay. Thank you so very much, Ogre. And moving right along, Cerberus, how are you tonight? We're having... I always have the same taglines. We're having a fun time talking about should transgender children have access to puberty blockers. I guess more of a serious one this time. But still, we're having a good time. Anyway, I hope you are. And what are your thoughts about the debate or the subject?
And then we'll feed the anti-gay people to the alligators, but that'll be after.
That's it.
Go ahead.
Real quick, right off the bat, because I had to jump in and out of the debate because I was putting my kids to sleep. Was there any issue found with the study that found like upwards of 9 out of 10 kids don't need them? Puberty blockers? They get put on them?
Ask the question one more time.
What did that study that was brought up? I don't know, was it like 20 minutes in or so? That said like upwards of 9 out of 10 kids that get put on them don't need them.
Did that hold up? I think is what he means.
Yeah.
Did it hold up? I don't know. The problem with that is I'd have to look through it. It caught me through a loop because he was using one of my sources. I actually dropped all my sources with my computer crash tonight, but I gathered a bunch of them, and he was using one of the main documents that suggest that it's safe for puberty blockers to be given to children, that was like his main article. And so I was trying to wrap my head around that the whole time.
Okay, so, I mean,
But I have to look it up.
as long as that study's good, then that puts, because I didn't research this a bunch, right? So based off what I heard in the debate, I think I might actually consider it morally reprehensible at this point to use puberty blockers in the way that we use them, right? We would need a way to either we would need conclusive evidence that there is no effects on the 9 out of 10 kids to get me to agree to it, or we would need a way to identify transgender kids from temporary dysphoria kids. Like I wouldn't consider those the same things, because like the debate is phrased around should transgender kids should they be allowed to use these, and I totally agree with that. It seems like a lot of the kids that get given them because of that are not transgender kids.
We don't know if that is how the statistics worked out. I don't know if that was kids who started transitioning and got the blockers and 9 out of 10 of them didn't need them, or if it's 9 out of 10 kids who had any gender issue but never went on the blockers or anything.
The problem with that, and yeah, I should, just like James was saying, the problem with what he was showing me was it seemed out of context, and it seems like what creationists all the time quote unquote evolutionists to defend creationism. And so I would really be surprised if the article was like, yeah, 9 out of 10 times this is not a good idea, but we're just doing it for the 1 out of 10 times that it works, because that seemed to be the point that he was trying to sell, and that is, as far as I could tell, not the mainstream opinion. I mean, why would they be giving it to, I mean, a pill that has a 10% outlook, positive outlook over it? It doesn't seem like that would pass the double-blind standards.
Well, see, I would agree that he well, like I said, I had to jump in and out of the debate, so I could have missed it. But his argument was exactly what you said, is that it can be harmful, those 9 out of 10 times. That study, as far as you guys were reading it, doesn't say that. It just says 9 out of 10 kids don't need it or end up not needing it, right? They go off of it and they don't want to do it anymore. And, the gender dysphoria goes away. So the whole entire... is there harm done is like an entirely separate argument from that study. I would say messing with people's puberty is inherently harm if they don't need it. But that's just a general statement. That's not based on any study. So I think I still have that position. I would need one of those two things where we can identify the difference between these two groups of kids, or show conclusively that there is no effects, period.
I mean, I understand what you're saying.
I think they do a pretty decent job of identifying them.
Well, I mean, if upwards of 9 out of 10 kids end up not needing it, that's like a 10% identification rate. I think that's awful.
Yeah, but are those 9 out of 10? Are those 9 kids who started transitioning and then didn't go through with it, or are those 9 out of 10 kids who may have had any gender issue, even if it resolved itself very quickly when there was no intervention of any kind?
Well, I mean, the study said gender dysphoria. I don't actually think they give puberty blockers for anything else unless there's some people that have growth conditions.
Well, no,
right? I think they give them puberty blockers.
But you don't get puberty blockers the first time you go to the pediatrician and say, my child is having gender issues. It's a process that would begin there, but you wouldn't go on them right away.
Oh, I agree. That's what makes it even more egregious, is that they go through all these steps and yet they still only have a 10% accuracy rating.
Well,
Like
that's
I would be more understanding if they just went there and automatically got them. Like, oh, only 10% identification. Okay, go through more steps. But they seem like they're going through all the extra steps and they're just doing a really bad job of it. Anyway, that's my whole opening. I got nothing else.
And honestly, I think we should. I want to find that article. We should probably go over it in open conversation. Also, thank you very much, Cerberus. We actually like opposing views, so don't think that our pushback doesn't mean that we love you. And all right, we are moving down. And all right, I'm gonna bring her in. I think she's.
boy.
Okay. And then after that, we're going back to order. This has been an interesting night. But thank you so very much, Cerberus. Amaretto. Woohoo! We are Midnight Ranting.
We need Oz's shark.
We are Midnight Ranting on should trans children have access to puberty blockers. I hope you're doing well. What are your thoughts about the debate, the subject, or anything we've been talking about tonight?
Unmute, Amaretto. You're mute.
Oh. I'll do jazz hands. Do.
We heard you better before. When you were
it's because screaming. you were hearing it
Can you hear me?
in the room.
Can you hear me now? Can you hear me now?
Yeah, we hear you now.
Okay. All right. Yeah, so yeah, you can hear me. Amy's at my PC actually tonight. I'm on a secondary setup. Yeah, so I had to fight to keep from like jumping in because I'm like, the answer is yes. Trans kids should have access to puberty blockers. Rob was very undereducated on the issue, and that's why I had my nice little super chat that said you should go talk to some trans healthcare providers. So as far as you know, some of what Cerberus is saying, the part of the issue is there's other issues at play there when you're talking about doing studies on children. For anybody who doesn't know, I'm actually working towards becoming a gender and sexuality specialist in healthcare, probably more mental health. I wanted to be a therapist, but I might actually be going back and getting my nursing degree too, because I'm crazy like that. But this is something I feel really passionate about because, you know, as somebody who is trans, non-binary, you know, I have, I'll tell you a little bit about my story, chat. I am a trans, non-binary, gender fluid individual. What that means is I don't feel I'm male or female. I'm kind of in a off the binary kind of thing. I also have elevated levels of testosterone. I had a condition called polycystic ovarian syndrome, which causes, among other things, male pattern facial hair. Amy and I joke that even though I was assigned female at birth, that I'm a lot like a trans female in some of the issues and things I faced. So I've had dysphoria over facial hair for over half my life. I wouldn't wish that for anybody. I wish I had access to puberty blockers as a child, because now I wouldn't have to go through electrolysis. I've been scammed on laser hair removal. The way that my body has developed, while, you know, I present as female and most of the times I do feel okay anymore, you know, being referred to as female, like there are times where I have severe dysphoria because of just how my body has grown and changed in my puberty. So I think that it's very important to give people time, you know, if they are questioning. And, you know, I'm in my 30s now, and I wish that, you know, I would have had that. I wish all of my trans friends who are older would have had the same opportunities. So I'm definitely for it. Now, here's the thing that a lot of these people don't even touch. puberty blockers are given to cisgender children as well. They are given in conditions where they're experiencing a very, very early puberty. I believe one of the documents I found, typically between the ages of 1 and 9, which I know sounds crazy, but the human body is a complex thing, and hormones are very powerful chemicals. So, you know, they don't address that. They always just think it's, oh, the only reason these are given are for trans kids, and that's wrong. It's a basis in transphobia. Because they don't say anything about the cisgender children. Now, in the case of where, you know, I think Rob by the end was kind of leaning towards, no, it's wrong, period. Well, you're not a medical professional. Where is your medical degree? You're saying that just because it's confronting something, a reality that makes you feel uncomfortable. You know, and the fact of the matter is, yes, like, you know, there are issues with puberty blockers, bone density, for example, or a decrease in bone density, I guess, but there's problems and side effects with all medication. There's so many side effects with female birth control, yet nobody really has a problem with that unless you're a super conservative Christian who doesn't believe in that. But typically, it's more acceptable in common society to be on birth control than it is to be on puberty blockers. It's all hormones, and it's all medicines have side effects. This is why here in the United States and other countries, like, it's a process. And mind you, he wants to bring up, you know, the British healthcare system. There are trans people that are being denied from getting the healthcare they need because of transphobic healthcare workers and people that also are insensitive and really shouldn't be in healthcare at all. The reason I say that, there's recently a British transgender, actually, I apologize. She might have been Irish. But either way, she was in the UK, Britain, Ireland. She was basically saying that she was being denied healthcare because a provider wanted to know about intimate sexual details, about how she felt with certain sexual acts, like getting a blowjob. And she didn't feel comfortable providing that. And it became a long thing. And I'll be honest, as someone looking to go into, you know, that area of healthcare, I would never react like that to a patient. And that's so appalling. So the other thing, like, you have to keep in mind too, is there are issues with trans exclusionary people in the UK specifically right now as well. And the conservative government, there's huge anti-trans sentiment over there. Same as here in the United States, there's huge anti-trans sentiment here as well. So you have to keep in mind that there's going to be a lot of pushback in regards to things that are going to confront, you know, people being uncomfortable with things they're not familiar with. So, you know, I think we have to definitely do a better job educating people. In many states and in the UK and Ireland and stuff, it is actually a huge process, a long, lengthy process. There are a lot of barriers. And to be honest, like, you know, people want to bring up detransitioning, or people who don't go through it, through continuing with a gender transition after being on puberty blockers in their teens. Part of the reason is because there are a lot of transphobes and people who don't understand, who are not supportive in people's personal and communal lives. So a lot of people end up going back into the closet because of a lack of social support and also a lack of money. I know at least 2 people who have detransitioned and then retransitioned back after they were in a better financial spot. So, you know, it's a really complex issue, but this is something I feel so strongly about because of my personal experiences and knowing Amy. Like, Amy and I have known each other for over a decade. I joke with people, it's, you know, when Amy's around and we, you know, they know, and we're all on good terms. It's like I knew Amy before Amy was really Amy, you know. And mind you, Amy's been Amy since before transition, but you know, we have a politically incorrect laugh every once in a while about it. So, you know, but I've seen these struggles firsthand. And even though I'm assigned female at birth, and I do walk through my life with a bit of passing, I'm in what appears to be a cis het normative relationship, and I have a child. But I'm not, and these kind of issues are really important to me. And just the amount of people I know who, if they had more social support, a better societal support and acceptance and love, they would be in a better place and they would have transitioned. And I'm going to share something in the main chat too that I want everybody to see as part of why I am so vehemently for trans-affirming healthcare. A young lady by Leila Alcorn, who was basically, her parents were Christian fundamentalists, I believe, subjected her to Christian-based conversion therapy, denied who she was, isolated her, walked in front of a semi-truck and killed herself. And even after her death, her family would not acknowledge her as Leila. And many of us on the trans spectrum, you know, questioning, have faced problems with acceptance and suicide. And my big thing is, if these drugs, you know, these puberty blockers can prevent even one suicide, and it's done in a manner that's, you know, it's with a medical team, what value you're going to place on a life. So that's kind of how I start feeling. Sorry to kind of go on a rant. This is like my specialty, but Amy, I'll turn it back to you.
Well, thank you so very much, Amaretto. And no, hey, we finally have a topic that's your shtick, right? Woohoo! And all right, we're moving right down the line. Leophilius, we're having fun. Midnight Ranting. And thank you, Amaretto. Hope you are doing well tonight. And what are your thoughts about the debate, the subject, or anything we've been talking about?
So I did not watch the debate live, but I did watch back probably close to a half an hour of it. I didn't watch much more because it was pretty evident from the way that Rob Noor was defending his point, and I've seen him on several Twitch panels. Before I dive into that, I did want to say that I thought the debate was respectful. Rob Noor is somebody who I would disagree. I'm just going to call him Rob now. It's somebody that I would disagree with vehemently on a number of different topics, but from what I've seen, he's actually quite a bit more respectful than many other people that come and go in this particular community and with what we do with all of the debating and the discourse. So I give him that. But he pulled his what I typically see him doing in tonight's debate, and the main problem is he was referencing research that was done by an organization in the United Kingdom known as, I think it's GIDS, the Gender Identity Development Service. And they faced 2 lawsuits from 2015 to 2019. 35 of their top researchers quit, and they have been mired in controversy based on the methodologies of their research, to the extent that I would argue that I think it's justified in, I think one is justified in not taking seriously anything that they say. Both the Mayo Clinic and what's it called, Pharmaceutical Technology, which is not an academic journal, but much like the magazine Psychology Today is a very well respected publication within its field. they both talked about how the data that this institution has put out is very much misconstrued, and quite frankly, it's not really that accurate. And to me, it there's just when I look at something like that, and I look at the amount of controversy that this organization is mired in, I don't think I don't think one should consider the research that they're doing. Amaretto said it. I can't remember if it was in the private chat or in the live chat that Rob Noor tried to make the debate more about more about I think it was gender identity than kids taking puberty blockers, and I noticed that too. And there are two research papers that I have here. One of them is a meta-analysis, and the first one is a survey of studies that considers roughly 27 or 28,000 patients, showing that things like detransitioning with gender-affirming surgery is extremely rare to the point of being negligible. And the broader point that I think that can be drawn from that is that when somebody feels that they are transgender, almost all of the time, though not in exactly every single case, that person actually feels that way and benefits from the particular medical technologies that we have available today that help them sort of mold their body, to put it simplistically, into how they feel in their mind. And I don't think there's anything wrong with that. I think that whether somebody agrees or disagrees, that people should be allowed to do that, because people should be allowed to pursue their lives in a manner as long as it doesn't do harm to anybody else. So I think that the answer to the question of tonight's debate and tonight's after show, should children, and by children I'm assuming at least 11 or 12 years of age or higher, which I would still consider children, because it's no younger than that generally that puberty blockers would be prescribed. I think the answer to the question is yes. The data seems to indicate that we have available to us that there are the harms associated with doing this would be nothing greater than the harms associated with taking a drug like Humira or what was it, Prozac or something like that. Things of that nature. There's always risks associated with any type of medicine, and there's always going to be. But the question here is whether it more broadly helps people and how broad that benefit is. And given that it is broad enough, we might consider that justification for allowing people to utilize this as a treatment for any particular for anything that they may be suffering through, whether it be physical or psychological.
Woo!
Woohoo!
Thank you, Leo.
So very much, Leo. And
So, Amy, I got
right.
called out. I got summoned by the devil. He says we're doing a bad job pushing these puberty blockers. He wants more of them out.
Damn it.
He needs more.
All right.
Yeah.
We're going to have to
We're not
put it
doing
in
it.
the candy again.
Yeah, I was
Yep.
gonna say we're gonna have to like taint the Halloween candy.
And the fluoride, I guess that probably does it too, according to Alex Jones.
Yes, and the chemtrails. We're going for it all tonight. And all right, thank you so very much, Leo. And we're moving down. Well, we're having fun, or at least that's the something like that. We're having a conversation talking about transgender children. Should they have access to puberty blockers? I hope you're doing well. What are your thoughts about the debate, the topic, or anything we've been talking about tonight?
I watched the debate. I didn't get to watch all of the question and answer section part of it. I had to get some work done. I was even doing it when you first started the stream here. But I'm wearing my libertarian hat today. So as a libertarian, I think that as long as the child has not been coerced or manipulated, which I know is a very rare case, but it does happen. I don't see anything wrong with it as long as there's no harm done to the child. I think that it's perfectly, reasonable to let somebody do that if that's a choice that they want to make. I'm for libertarian choice, even for kids. I try to not. I have the way that I live my life, and I have my beliefs, and I'm not shy about them, but I don't force my children to affirm or disaffirm any of the things that I believe. I let them choose who they want to be. So I'm not an expert on this from a scientific or medical point of view, but from a political point of view, as a libertarian, I say as long as there's no harm being done, then that person should have that choice. And I just don't see why there's an issue. There in the rare case to where it's a parent who, in a very, very, very rare case, let me make that clear, where it's a parent who's on that political side and they're maybe influencing that. Like, just for example, from the one of the Biden town halls, that there was that one lady who had the 6-year-old who they wanted to do that with, or 8-year-old, 6-year-old or 8-year-old. I think that's a little bit wrong if you're kind of pushing the kid in that direction, because as you know, this is a thing that people struggle with. This isn't something to be cool. I don't think people should come from that angle at all. I think that's wrong. But I mean, if this is your general feeling that that's who you are, hey, that's who you are. You should go and do what you want to do. I think the doctor needs to be very, very, very careful that it's the child's actual position and not something that a parent is being pushed off from that. But outside of that very rare circumstance, I see no problem with it. That's my opinion.
Mm-hmm. Well, thank you so very much, Will. And hey, I think the moderates get well along with libertarians sometimes. Okay, thank you so very much. We'll keep on moving down the line. Marshall? And then we'll eventually go into open conversation. I hope you are doing well tonight. We are talking transgender children. Should they have access to puberty blockers? It's going to be both you and P. Mars. Then we'll go into the open conversation. How are you, and what are your thoughts about the debate, the topic, or anything we can talk about tonight?
I'm doing well. I don't know if I have that much specific knowledge to add. I think there are other people here that are a lot more knowledgeable about this issue than I am. I mean, I think it's pretty simple. We just listen to the doctors and let the doctors make the right decision. But I definitely want to shout out Amy for stepping in and stepping up, and you're a badass bitch. That guy the debate was difficult to watch. Like, that guy's just difficult to listen to. I imagine talking to him it's just like talking to a brick wall. I noticed he seemed to have a lot of faulty reasoning regarding statistics. I haven't looked at any of the actual numbers he was putting forth or anything, but it was an obvious fallacy in that he's taking a percentage of the people who have expressed gender dysphoria. That could be questioning their gender or whatever, and then extrapolating that out and trying to make that as an argument about like all the that percentage of people who are given puberty blockers would have changed their mind if they hadn't been given puberty blockers. But the problem is that the people who are more likely to be put on puberty blockers are going to be the ones who are more serious about their gender dysphoria, right? They're the ones who a psychologist has determined to be actually be trans. So it's a sampling error really. Kind of hard to explain. I don't know if I've made the point right, but it's like he's trying to make the argument that by allowing somebody to go on puberty blockers, that's making them trans. Like, he thinks that there's some kind of conspiracies out there where we're trying to force people into being trans by putting them on puberty blockers. I assume. I'm not sure exactly what he's trying to get at, but it's definitely he's not using statistics properly.
He's playing with them.
Exactly.
He's playing with the stats. Yeah.
Yeah, and I just want to say, yeah, again, this isn't a topic I have extensive knowledge on, but I just want to say, shout out to everybody that, and anybody that's questioning their gender or their sexuality, or has, accepted it, but isn't, don't feel like they're accepted in mainstream society. I just want to tell everybody that they're valid and I love them.
Thank you, Marshall, for
Well,
that
we love
sentiment.
you,
Yeah.
Marshall. Woohoo! And okay, thank you, Marshall. In fact, thank you both, Will and Marshall. And I'm going back and forth. They're giving me warnings, PMARS. They're saying you're gonna spam stuff. Are you here to have no
Yeah.
PMARS?
That's not PMARS.
It's worth it just mentioning that PMARS is known for using racial slurs, whether on his main or on socks, creating socks and using racial slurs with very racially charged or xenophobic names. He's known for trolling. You can let him in at your own discretion. That's what I'll tell you. It's not my channel. I personally wouldn't do it. I'd just kick him out from the backstage.
I don't think it's PMARS. I think it's
that's
PMARS.
PMARS.
What they're saying.
Okay, but real quick, I mean, I usually disagree with Leo in these panels, right? But I agree with Leo on this. PMARS is not a good person to let in here.
Yeah, and Titan's been blocking him in chat. So, because I asked him what was up, and racist.
I have never kicked anyone before.
Well,
do it.
Are you
kick him? Kick him.
Are you
Give him the boot?
Are you here to troll to give a point? I am so bad at this. What do you think? James is my co-host. What do you
see what he says? Anything racist, we'll just boot him out.
They're lying on me.
No, I mean your mod, Amy. You got to remember Titan.
Well, no, I know. I'm talking with Titan right now.
Oh, dude. PMARS is not. I'm just my personal opinion. I'd just kick him out of the backstage. Wouldn't even bother. It's just.
Do you want to say something productive, PMARS? Are you here to talk about the subject?
Oh no. So let me explain this to you. If I had the time to go back and take all the clips and everything that people have gotten of PMARS or that he's done in live chats, you would not be questioning to let him in or not. You just wouldn't let him in.
Yeah.
Yes,
Pat's even saying you should kick.
Yes, I was going to help your show. I'll be honest. That is a
right
weird
there.
phrasing of a sentence.
Yeah, don't trust them. Oh my gosh, Amy.
I don't trust anybody, but I'm also sometimes a little too nice. Like the knife could be in me, and I'd be like, "Oh my god, I'm so
see it,
sorry."
Randy, in chat. PMAR is almost always racist in my experience.
I don't know if he's racist.
The worst thing that can happen. I am trying to run a decent stream. That is.
That last comment there too isn't very reaffirming.
Yeah, I don't know if he's racist, but he will bomb the chat if he gets.
What do you think, Will? You're a libertarian.
Well, I mean, hey, freedom of speech.
Randolph's here.
Let him have a role, and just as soon as he makes the wrong move, that's when you would kick him. I
Yeah,
guess. I mean,
let's ask Randolph.
Yeah, but when he yells the N-word in chat, what's going to happen is she's going to lose her video.
Because the thing is,
you won't.
He might be serious for like the first 20 or 30 minutes, but then all of a sudden there will be a sock in the side chat spamming the N-word or other racial slurs one letter at a time.
Yeah, kick him. Not worth it.
There's a reason why Titan is blocking him on site.
Yeah.
I haven't done anything in the side chat simply because he hasn't said anything, and I was going to be charitable and give him a chance. But as far as bringing him in, I don't think he should be hidden. But as far as bringing him on the stream, personally, I would recommend it. But it's not my channel. At your own discretion. That's what I would say.
Amy, I think like Titan's a pretty stable mod, so I think if he's saying I would.
If Titan thinks he doesn't want him in, then probably just don't let him in.
I mean, the thing that gets me
Amaretto,
is
you're roboting.
if Siberius was against him, I don't know if I would.
Well, look, here's the thing. I think he's funny. I think he's funny.
Massive window.
Sorry, that was me.
I think he's funny, and if this was like a private chat, I would have no problem with him being in here. But I think he will actually do things that will get this video removed.
I mean, I agree. If this was private, if this wasn't live, yeah, bring him in. Who cares? But yeah, I wouldn't do it. I wouldn't, me personally, I wouldn't do it, and I would just kick him and let's move on and stop debating whether we should kick somebody
Living or
who's
not.
known by everybody in the community to be just
I don't.
a nasty
Amy,
troll.
there's a first time for everything.
He's a nasty troll. I'm not saying anything personally about his character. He might not believe the stuff
He
that
doesn't
he
have a
says
good
and what he does,
reputation.
but he doesn't
I-
at all. He's a troll.
I would just
Huge.
say this is a sensitive subject, P. Mars, as it is. Can you just come back and on another episode? If you don't have something like super, I don't want to kick you either. Just come back on another episode, maybe.
Shit.
Yeah, do something about that win there, Phil.
I mean, Smokey's got to be running a stream. He can go sit with Smokey.
I still heart everybody. I still heart. Okay, let's
right.
just go back into open conversation. 1, 2, 3, 4. We're having a good time, or as much time as a serious subject can be.
Is Randolph back there?
No, he's not. But hi,
No, I thought
Randolph.
somebody said
Send him
Randolph was
love.
back there.
He's in
I
the
think
chat,
they
but
mean
he's
he
not
just joined.
back yet.
Yeah.
He's in chat. Okay.
In fact, I should probably pin it. That would also help.
Will's got the Oz meme going on there with the shark
Dude,
getting
that's pretty
attacked.
clever, yeah.
Yeah.
Pretty clever, I thought.
Can't wait till Oz sees that. He's going.
Okay,
Whale
so
getting
are we
shark
in
getting
open
attacked by
chat
the
now?
whale. Are we in open chat?
And
Yeah.
all right, I'm sending the link back in chat, and I'm pinning it if you would like to join us. We're having a fun time.
And for God equals the square root of -1. Yes, I am. That's quite obvious. Let me clarify that to you equivocally.
That's
yes.
why I literally died when I saw Will's picture.
Come on now, it's funny.
That's all good, Randolph. We're still sending you love, and it is funny.
You didn't,
And
Randolph doesn't
Loretta
wanna come
noticed
on?
it instantly. I didn't. She was like, that isn't us. I was like, oh, yeah.
The shark getting attacked by the whale.
That was kind of quick on the draw there.
Yeah.
That's why they're called killer whales. Don't fuck with killer whales.
Orca.
I mean, it happens at
literally
least.
got free for a reason.
It happens at least like once a year that somebody will sneak into like SeaWorld and just swim with them overnight, like when the place is closed down, and they're almost always found floating dead in the water the next day.
Oh my gosh.
They're the
Yeah.
boss of the ocean.
So
Well, you
I-
see how they are with the trainers, and it looks easy. It looks like, oh, hey, you just go in there and have a good time with them, but
So yeah,
not really.
so concerning everything tonight though, like Amy, I thought you did a really good job for all the chaos that has happened. So
And I just will say that, and thank you. I feel good. I know I could have done better. For whatever reason, today, my computer right now is kaput. But I still think for what it was a good conversation. I
I
don't
don't think
I want to
we've
look
ever
at
had a
that
perfect
document. I'm
debate.
trying to
yeah, I was gonna say I want to see that. Oh my gosh, sorry, I'm echoing through your headset.
like.
I mean, I don't think anybody's
Oh,
had a
yeah,
perfect
sorry.
debate. I don't think there's ever been a debate where there was nothing somebody could have said better. But I thought you did very well. You just got word of this yesterday, so it's not like you had months to prepare. So
And I mean, this is an important topic, and I won't limit. I don't want to just throw it out as just politics, because I am more to the yes than the no, and so that puts me, on the need to have a burden of proof. Though that was one of his points. I thought he had a burden of proof. That I don't think that I think he was making
yeah,
a bunch of claims. Grandiose claims at that would be hard to prove. I'm really trying
he's the
hard
one,
to
yeah.
find this one down.
Yeah, I
he's
was
the
gonna
one
say
who wants to
somebody.
run in there and tell the doctors that no, you can't give
Yeah.
them that prescription because I don't think it's a good idea. So if that's your position, you want to restrain the doctors and the parents and the children, then
Also,
it's
someone
going to be more harmful.
was saying that they thought that like the largest sample was 150 people, and said like that doesn't seem like a very large portion. Now, and that's
Not a
and-
big enough sample.
Yeah. that's a hard thing, because here's the issue we're talking about. First off, when you're talking about doing studies on children and stuff, that's a whole other ballgame. Now, mind you, like whenever you're doing research and, you know, not necessarily experimenting, but doing like even surveys and stuff when it comes to people, like there are, at least here in the United States, very strict code of ethics. I can't say that Britain does or doesn't in other countries because I'm just not too familiar with that. I just know as someone trying to go into healthcare in the United States, like there is a lot of ethics. Like they hammer that into you starting in Psychology 101. And with children, it's even more so because they're children. And so also you're dealing with a portion of the that not just more vulnerable, but also there's not a large portion of the overall population. You know, I know that LGBT people don't even comprise 1/4 of the entire population of the United States. I'm almost positive. I'm going off the top of my head here, but
1 in 10. That was the old statistic. I don't know if that was true.
Well, you are dealing, like I said, it's a small portion of the population, and then you're also dealing with some of that population. I think there's issues when you're talking about studies and samples of LGBT people, just in general, because it's a small sample, it's a small population, and it's also because of a lot of the societal and familial stigma, like from family, society, issues with employment, stuff like that. It's also a portion of the population that might not be open. Closeting is still a big thing. Like Amy and I would talk about people who would go quote unquote stealth, which are trans people that do have gender confirmation surgery, what used to be called sexual reassignment surgery. And then they actually don't reveal that they're trans. They basically just, you know, go through life and letting people think that they are the gender, that they were born as the gender that they are living at. And so, you know, there's also those portions of the population as well who, you know, whether for personal or safety reasons, won't ever say if they are trans or not. So there's a lot of issues with that. We definitely need, I'm for a lot more research on these topics. But, you know, I think that people are looking at it as though everybody who is LGBT is out and proud and we know all about them, when that's just simply not the case. And as in the fact, like the case of Miss Alcorn that I linked to in the chat earlier, even to this day, like her parents don't acknowledge them as Leela. Their headstone has their dead name on it.
I mean, we have to realize, that it's hasn't even been that long that we've been able to speak about this openly, like the LGBT issues. You don't have to go back 25, 30 years where it was very much taboo, very stigmatized.
And this is the thing. Trans people have been around forever. There are more than 2 genders, and there have been in many societies longer than any of us here have been alive, longer than the United States has existed. So
the Hindus had a word for it. In ancient Hindu culture, there was a word for a person who identified as neither a man or a woman. I can't remember what it is off the top of my head. There were terms for it in Roman and Greek culture. This has been around for literally millennia.
Yeah.
But I mean, a lot of these things that people point out, like these third genders in history, I mean, generally just sum up as they're gay. Like if we were to call them by the terminology we use today, they end up being just gay.
No. These aren't people, because these cultures also knew what it was to be gay, and that's not what they were referring to. Yeah. Especially that term in Hindu culture. Again, I can't remember what it is off the top of my head, but I know that the referent of that term had nothing to do with homosexuality.
Hinduism has a very complicated view of gender, so they have a lot of a lot to say.
Yeah, and it's a complicated view of gender, not sex.
There's nothing new under the sun.
Well, I mean, I would say gender wasn't even an idea in most of these cultures. I mean, a lot of these cultures actually didn't have an idea of what gay was.
No.
I mean, actually, they were there's a lot of, you know, importance on gender. Mind you, gender and sex are not the same thing.
Yeah.
And these third genders are proof of that in a sense,
Yeah.
because, you know, a lot of them are cultures where you would have people that were assigned male as birth that would adopt a female role in society. And to what extent, like some of these roles, you know, do involve like castration, you know, surgical means on the genitalia, and others don't. But typically, no, it's not that they would be called gay. I mean, if you're going to say gay in the sense LGBT, that Amy and I, we say simplify, we're gay, then yes. But I think, you know, in a term of loving and being sexually attracted or romantically attracted to somebody of your own gender, no, I don't think that's quite it at all.
I'm not sure if they
No, like I'm
looked
referring.
at it that
Where's your banner?
specifically.
Well,
I think they looked at it more as
sounds
a
gay, I'm in.
like. I don't think that they thought
if
of it
it's
in the
gay,
same
I'm
way
in
that we think of it today. I think it was more of a because it wasn't until I guess you could say the nationalization of Christianity, you know, during the later parts of the Roman Empire that an open hedonism was looked down upon or was somehow socially unacceptable. So you have to look at it in Roman times. Or I mean, even in the New Testament itself, when they're talking about Corinth or other cities in that time, the problems that they dealt with were incest, pedophilia, all kinds of things that are socially unacceptable today were commonplace then in certain cultures. So I don't necessarily think that I think it was a far more open spectrum there. I don't know if they thought of it as being as personal today as it is today here.
Well,
I did want to say really quickly, I found the word. It's hijra. And it says here from Wikipedia, in the Indian subcontinent, kinars, or hijras, are eunuchs, intersex people, and transgender people. Nothing about homosexuality in there.
Okay, but nothing about a third gender either.
Kinars are eunuchs, intersex people, and transgender people.
Okay.
Which was what I said, that the Hindus had a word for transgender people.
Hey, but we're talking about
Not homosexual people, transgender people.
Yeah, when I said homosexual, I'm talking about when they say a third gender. That's what.
Wait, but who had initially mentioned a third gender? I didn't. Maybe somebody else did. But I don't recall mentioning a third
So, like,
gender.
what I'm going off is, like,
I did.
for example, like the Hopi, what people call the Hopi third gender, really was just gay men.
Well, I don't know what that is, but that's certainly not what I was referring to.
In general, the roles that were acceptable for men and women were just broader in the past and in most cultures. So there wouldn't really be a room for a third gender.
I don't know I don't know what we mean or why we keep referring to a third gender. This is lost on me.
Yeah, I said
like,
it.
The concept is lost on me. Like, I don't know if anybody knows exactly how many genders there are, or whether that's even a meaningful question to ask.
It's contextual if it's meaningful. Right? It depends on the culture you're in, really.
Yeah, I mean,
I guess I suppose. Yeah.
There's good old Wikipedia on it as well. But I mean, there's a lot of examples of, you know, and not all cultures have two genders or three genders. Some have third, four, you know, maybe more. You know, and the gender is going to be determined by, you know, the societal norms and values. So, you know, there are some cultures where, yeah, I mean, the line gets a little bit more blurred compared to, like, I'd say 1950s United States, for sure. Just because everybody knows Stepford Wives, or, you know, that's some very strict gender role stuff right there. And other cultures don't. But, you know, my point is that, you know, people who are LGBT have existed all throughout history. And, you know, there are people who want to say, no, if you were born a man, you're always a man. And that's just incorrect. Like, I think that, you know, a binary model of gender is just, it's not true. It's not complete fact. I don't think that you have to be either or. And I think forcing people into those boxes is a bad thing.
Yeah. How do you go about that? Forcing someone to do a box.
Well, the thing is, I think this depends on where you are. Like, if you're in an area where the box of what is male and what is woman is so broad that there's no gap in between them or around them, then could you ever have, like, if it's acceptable in a society for males to do basically everything women do, would it even be meaningful to say someone's transgender from like a man to a woman?
Well, this is the goal, isn't it? You're talking about gender abolition. That's the
want it to
goal,
be
isn't it? I
basically-
mean,
Oh yeah, I'd be perfectly fine with gender abolition, but then you're basically just back to you're a man and you're a woman.
well,
No,
no,
not
man and woman
necessarily
are
so.
gendered terms. Male and female are sex terms. Man and woman are gendered terms.
They're both. Men and women are both. And they were
Not
first.
really in
Not-
biology. You like if you open biology textbooks, whether it's referring to humans or any other bimodal sexual species, when they're talking about the differences, the dimorphism, you almost always see man or male and female, not man and woman.
yeah, I'm pretty sure
Those are
anatomy
gendered
and
terms,
physiology
not
Yeah,
sex
textbook
terms.
Yeah,
doesn't-
I'm just talking about the language.
It's
Yeah,
very
but I-
recent.
but I mean-
But when people talk about a man, they're referring to more
Leon,
the
what you're
particular
talking about is a very recent
behaviors
thing.
that somebody portrays that we associate potentially with being a male, but that
Right, but
doesn't.
yeah, what you need to understand is that's a very recent thing.
Well, actually, no.
Actually,
Like I just
societally-
cited a word that's
societally norm,
thousands of
yes,
years
it is.
old, referring to transgender people. What are you talking about?
I'm 40 years old. When I was growing up in the 90s, people didn't talk like this then. They didn't.
because
it was
we
not
here's we
society.
also
Well,
didn't have
because
the
you weren't
internet when we were
exposed to
growing
it.
up.
Normal.
There-
You
we
weren't
didn't have-
exposed to it.
It wasn't the
didn't have-
norm then.
Yeah,
What do you
but
mean
that
by
doesn't
norm?
mean that wasn't the norm, quote unquote. It wasn't talked about as much because you didn't have the internet when you were growing up. Not because I'm 33, dude. We didn't have anywhere as near knowledge, easy access to information and other people as what we do now. This is part of the reason why people are in disbelief about the issues with African Americans and policing. Because for a lot of white people, like my family, we didn't see that growing up. But we also lived in a mostly white community and in the rural suburbs. So I'm just saying, the reason that this wasn't the norm was because we didn't have as much knowledge and as much general broad connectiveness and the ability to talk to one another and exchange these ideas outside of academia and, healthcare is what we do now. But trans people have always existed.
I'm not saying I'm not saying trans people didn't exist. I'm talking about the distinction between gender and sex was not normal, commonplace conversation
So
until recently.
Can I ask you a quick question? And this is going to sound really weird, but I'm asking genuinely. What do you mean by normal?
Normalized.
So
What the
wait,
word normal means.
you mean it in the sense of something being considered usual or typical?
Yes.
Okay.
Yeah,
Okay.
he's
So
meaning it in
it's
the
a social
sociological
construct. It hadn't this concept of there being a difference between, there were transgender people then, but even them didn't necessarily, they may in their circles have talked in this manner, but as a society as a whole, it was not normal to distinguish between gender and sex. They were
When?
either are. 80s, 90s,
Okay,
early
that
2000s.
so there's 30 years.
I mean, academically, the word's been used since like the 40s, right?
Well, I mean, even outside of that,
popularized
most ancient cultures had terms for people of different genders.
No,
and they recognized
stop.
that there was a difference between what these terms referred to and the biological sex of the individual.
Because
So
there
there might have been a period
term described
where
the
the
behavior.
prominence of particular religions eventually came to suppress the otherwise more prominent sexual expression that humans have had that we see present in many ancient cultures. But that's not to say that this hasn't always been
That's not what I'm
normal.
saying, Leo.
For
You're arguing
most of
against-
human
you're arguing
history,
against
it has
yourself.
been.
You're arguing against yourself.
So what I would say to that is we're kind of also, again, like it's a different understanding. We're also finding ourselves needing to differentiate between like sex and gender, and in the sense that you're one, gender is a little bit more inside your head, and sex is more referred to a biological process. Now, that's not something I wholeheartedly agree with, but I think that's what the attempt has been made to do, is to separate the two, because they get really hardcore intertwined a lot, and nothing gets processed or done because everybody's too busy fighting over that. And there's still people that not dead me, but misgender Amy, even tonight in the chat, because they cannot get that there's a difference between gender and sex. So
Well, no, I mean they're just trying to be mean, right?
they are, but I mean, these people also truly believe this kind of crap.
Well, I don't think you can separate them. I don't think an X chromosome and a Y chromosome, like the barriers on behavior from those are. I don't think they're as hard as people like to think they are.
Wait, I don't understand what you're saying.
Yeah, as a femdom, I don't understand what you're saying.
There isn't anything non-biological about gender. Right? It all comes down to what you want. It's all biological processes.
Well, I mean, in like an extraordinarily like essentialist view or reductive view, yes. But when most people refer to biology in the sense of relating to gender, what they typically mean is that there might be a correlation between gender identity and biological sex, but there is not an identity relation between the two of those, nor is there a causal relation between the two of those. That gender might be something that is loosely based around biological sex, but extends beyond that. There's an extension to that. So, and I've actually just been reading on some websites. This is documented throughout thousands of years of history, throughout dozens of societies. This is something that has been well recognized for the vast majority of history. A difference between gender and sexual, a difference between gender identity and sex and sexual orientation, an acknowledgement of people who don't identify as male and female, a full recognition of the bimodality of sex and the spectrum of gender.
Oh yeah, but none of us is disagreeing with you on that. It's weird that you keep on saying it.
Well, because I'm bringing it up because I think it's an important point.
Right, but nobody's disagreeing with the fact that
so people, I can only bring up a point when people disagree with it.
Well, I mean, who are you arguing with?
Wait! I can't make a point outside of an argument just to mention it as an important point.
If we're trying to have a conversation, do you want me to keep on bringing up points?
I'm sorry, I have to be honest, but this sounds really uncharitable. Like, there's no other response to what I said. So let's just like disparage what I said. Is this isn't relevant. Why are you bringing? I'm sorry. I have to be honest. Like I like both you guys. I really do. But this sounds really uncharitable.
You brought it up. It's that you brought it up over and over and over and over again.
I actually haven't. I've brought it up maybe 2 or 3 times. Anyway,
actually,
let's move past.
Okay, good.
Like picked up third genders, so y'all. I was the one who originally brought it up. If I remember.
Yeah, how dare you?
I'm even cool with there being third genders. I don't think that's even an issue. The only point that I made that Leo started arguing a completely different argument than what I made, was that there was not a clear delineation between gender and sex.
Yes, there is.
As a normal standard in society until recently. There wasn't. You weren't alive.
Well, see, and this is exactly why I brought up what I did, is that we can see present throughout history that there is a clear delineation between gender and sex. So I'm wondering what you're saying, but then when I bring that point up, you dismiss it as how is it relevant to what I said, when it obviously seems to be relevant to what you said.
There wasn't a delineation.
You seem to be thinking that because there wasn't a delineation in like some particular, extraordinarily narrow area in history, like
you're
a
being
few
completely
decades.
Dishonest. That if you
but
were to
the way that you're presenting your argument seems to be that throughout history, there's never really been this is a very novel thing. This gender versus sex, this gender identity and sexual orientation, and the nuances between them. I mean, I'm not necessarily saying that you're lying here or anything, but the way you're presenting your argument seems to be such that you're giving this idea that this is very novel, and I think that a reasonable case can be made that this isn't. This is well documented.
The way that it's delineated now, the way that it is discussed now, it was not discussed that way.
When
any time in my lifetime other than the past 10, 12 years.
To be fair, Will, like you have a very narrow perspective, especially on something like this, because of the community that you grew up and raised in.
I went to public school my whole life.
good for you. I went to public school with Mormon kids. That doesn't mean anything. Like, that doesn't mean, you know.
Right, but what I'm saying is that anytime that I discussed being a man or a woman, anytime I filled out a form, a government form, as man or woman, I didn't check male or female. There was no delineation. There was no other check mark box. What I'm saying is it wasn't socially normalized like it is today. That's all I'm saying. And that's just simply a fact.
Yeah,
There may have been circles. There may have been academic circles that talked about it. There may have been niche groups at that time, but it was not a mainstream issue like it is today.
Abortion was the mainstream issue when we were growing up.
Yeah, Leo, in order to make the case you're trying to make with the evidence you have to show that those extra terms that were used are not
What
just,
extra terms?
You said they had names for these people.
Mm-hmm.
Yeah, you'd have to show that those are not subcategories of a gender.
They're not.
They're listed as third
like,
gender.
Well, it seems like you're
now
trying to insinuate that like professional linguists who study these ancient languages for literally decades, like there's
show me the name.
How many languages do you
a handful of people, and
thing,
what
like,
they say. Well, I did. Like I cited from a pretty well-respected outlet on
how many languages do you speak?
that said that these words meant people who were transgender. What these people meant by these words is what we today would understand as being transgender. So it seems like you're just trying to like move the goalposts on what the words mean.
No, what I'm saying is we would consider them today to be transgender, right? But gender is contextual to society.
But what we're like,
right,
if you look on the link that I posted in chat, and they find you Wikipedia, but it's got 3 different sources on this line. Like on the last line of the 3rd paragraph, they literally say, you know, as misrepresentation of the cultures. They've basically, in widespread misrepresentation of third gender people. They've accounted for some of that. When they're looking back, like historians and archaeologists and stuff, they usually account for things like this.
Exactly.
I mean,
like,
I've read a lot of
the
this
academics.
Because this is the thing in things like sociology and, you know, other academic fields that, you know, archaeology, stuff that is applicable to this. You also have to take into account your own personal biases and your ethnocentrism, which is basically.
Well, exactly. That's what I'm getting at.
So
right?
I'm
asking Leo to discount his modern sense of these terms, and actually trying to find out if the people
interpreting these terms in a modern sense.
Well, I mean, the article.
I'm understanding, but you have to understand about language. When we look to ancient languages,
how many languages
in many instances, the best we can do is approximate to what they meant. There's a lot of instances where we can get, you know, obviously exact to what these people meant.
Yeah.
But in some instances, all we can do is approximate what they meant with our modern languages. So we always have to compare, because the only way we're going to understand things is in the language that we understand, which isn't going to be the language that they necessarily spoke.
And this is why there's also issues with translations with the Bible.
The referent of the word transgender today is the same referent of these words in the ancient culture. So the words differ, the language differs, but the referent does not. They're referring to the same.
They're referring to a man who became a woman.
Is Pat here backstage? Because Pat might be able to.
They're referring to a man who became a woman, or identified as a woman.
Of course, the reference
is a woman. Of course, the reference is the same.
That's why we're calling it transgender now, because the reference.
They didn't have a word. Well, they did have words for that, but they didn't have. I mean, they had words for it that made sense in their linguistic frameworks.
Here's the thing. If the term for the person that we would call transgender was just considered a subcategory of 2 genders, essentially,
there's no evidence of that.
Well, there's no evidence of it otherwise, though.
Yeah, but there is, because we can understand what they meant by these languages. We can look at the structure, the way that suffixes and prefixes and all the various structures, the semantics and the syntax of these languages. There are people that study this very, very well, that understand it very well, that can look at it and understand what it means. People do this with the Bible. People do this with the Quran. This is something done by everybody.
Do you speak?
I feel.
Oh my gosh,
I have to be honest. I feel like you're just moving the
Settle this.
goalposts
I'm not
on the
moving the
idea
goalposts. I'm
that
asking you a question.
I'm not talking to you, Will. I'm talking to Cerberus. I feel like they're moving the goalposts on the idea that transgenderism and recognizing that transgender people are real, and that there's a delineation between gender and sex has existed for thousands of years. I feel like you're just trying to move the goalposts on that. Like, oh, well, how do you know that this? And well, how do you know that that? I personally don't. I would encourage you to go talk to the linguists. But when you read what is being said about it, it seems clear that this is the reference that is meant by
I'm asking you for the actual evidence, right? That's what I'm saying. Show me that these are not subcategories. That's the thing.
That's not how they're understood. It's like asking me, show me that an electron is not a subcategory. Electrons are electrons.
When you translate it to into modern language, right? Of course, it's not going to be understood like that because you're translating it to how we think now.
Yeah, but if the reference is the same, then
you're saying that these people have done this, right?
Have done what?
They went back into the past and went, oh yeah, they thought of them as something other than a man or a woman because
yes.
So
Yes, that's what we thought of them.
Show me that.
Because people are talking about people who didn't identify as a man or a woman. The evidence that these people existed and that people knew about them and had words for them is the fact that people talked about them. I don't know how to make this simple. That is evidence. Wait, hold on. You're saying history isn't evidence?
Cerberus, are you?
History cannot be interpreted through a modern.
Well, here, let me address him because Leo keeps on talking. Right, it's very simple. Nothing you said. That simply having a specific name for this group of people, doesn't mean they're considered a separate category. They could be a subcategory.
So, what do you think, Cerberus? Do you think that the woke historians went back in the past and just reinterpreted it to make it look like it was
recognized? I'm gonna tell you, most historians are not the social justice rogue I am.
Oh yeah,
well, just trying to make it look
woke. I think in general they tend to be anti-woke. All I'm asking Leo is to prove my point.
So you don't trust?
I don't think Leo is an academic on the subject, but I guess that's what
Leo
that's a consensus, I guess, from most historians or from what people would think.
But what?
I mean, if we want to talk about
issues
with language and translations and stuff, why don't we get Pat in here so Pat can shed a light on how academia actually does things?
I'm fluent in one language and I've lived in other countries for.
How is any of this relevant? I'm sorry.
Because
how
I'm
is
going to
any
let you
of
know.
this relevant?
I'm going to exactly tell you how. The reason why I'm asking you, how many languages you speak, is because you don't understand how translation of languages work.
Well, no, I'm saying about how translation works. I'm just reiterating what the academics say because you're right. I don't know it, but I trust that the academics do. So if you're telling me wrong, then by default, you're saying the academics wrong. Because if you go look it up on Google, you will find that nothing that I said disagrees with what the academics are saying. I feel by trying to ask how many languages I understand, you're just trying to play at the fact that I don't understand what you're talking about. So I'm not capable of having a comment. I think it's obfuscating the discussion.
Can we get Pat in and let him have his say on it? Cool the temperature down a little bit.
Woohoo! We've been having fun. If you just joined us, we're talking gender tonight. We're talking transgender kids. Should they have access to puberty blockers, as well as just the entire topic of really gender itself? Pat, I hope you are doing well, and what are your thoughts about the debate, the topic, or anything that's been said tonight?
Well, I promised myself since I was working remotely that I wouldn't jump into a conversation tonight, and I was just going to be a witness and a viewer. But given the subject matter, I thought I'd weigh in. As far as transgender adolescents and the use of hormone blockers, I think it's a decision to be made by an informed medical staff and both physical and psychiatric professionals as far as medical staff is concerned. So both the psychological and physical aspects need to be addressed. Beyond that, I'm just here to, Amaretto asked me to come, and so I'm here. And so if you have some questions regarding gender and normative language in antiquity, I'll comment on the cultures that I study and If that's something I can help you with, I'll be more than happy to do so. So I'll just kind of.
Yeah, can I ask you?
Please, because they're going on about stuff in academia, and if you didn't mind jumping on, I was like, well, let's ask somebody in academia so that they can confirm or deny what everybody is saying.
So we're going to have a few questions with Pat, and then we're going to bring Danny in. But
can I ask a very related question to this, Pat, and you tell me what your opinion on it is? So when linguists or linguistic historians, what have you, the academics that studied languages and what they mean today and everything like that, is it possible for them to acknowledge that the reference of certain words in ancient cultures are identical to the reference of certain words today by understanding the semantics and the syntax of the languages of those times?
They can reach a very high level of probability that they're making direct comparisons. So
okay,
yes.
So would it be fair to say really quickly that they're approximating very reliably to the referent of a word that was meant back then that we mean today?
As best they can, yes.
Okay,
that's their goal.
Yeah, awesome.
Yeah, it's from my
That's
understanding.
really the only question I have.
Yeah,
I don't disagree with that. Through their own biases.
Well, I wouldn't even say
but they're trying to
I would just straight up agree with Leo and what James or what Pat said.
Yeah, we do.
Because that's not the point I was making.
Well, my point rested entirely on that, because it seemed to me you were saying that there isn't a way for professionals to know what they really meant back then and if it really matches up to today. But it seems to be the case that we might not know certainly what they meant, but we can very reasonably and very accurately approximate what these people in these ancient cultures meant by certain words. And we find that there seems to be delineation between different genders, an acknowledgement of that there's gender, that there's sex, and a delineation between them, and a delineation between different gender identities.
Well, what my argument is it seems like you're confusing your really low-res opinion on what they're saying to be equivalent to what they're saying. That's why I was asking you. Right, this is why I was asking you for them, not for what you say they said.
Well, I did share a link that cites I don't know how many academic sources on the matter.
Okay, but where did you get your information from that you're giving me here?
The link that I put in the chat.
Wikipedia, not where Wikipedia
well,
got it
no,
from.
Wikipedia isn't the source. The source is the Wikipedia sites, which are almost exclusively academic sources, or at least reliable secondary sources, like Scientific American, Popular Mechanics, things like that. So, I think Wikipedia is just like the Encyclopedia Britannica. It's not the source itself, but it cites all the sources, academic sources for its information.
Yeah, I know. I don't need that explanation. I'm asking. I'm not asking for someone else's interpretation here in Wikipedia.
Well, wait. So you're assuming that Wikipedia doesn't fairly or accurately represent what the data is saying?
Many times they don't.
Yes, but this is why
you have evidence.
Well known.
Yeah, that's why I'm asking you, where did you actually learn this? Like, seriously learn it, and not just Wikipedia it to try to have an opinion.
Well, because I cross-reference the sources that Wikipedia shares. So I can type in certain papers that they cite and then find a whole slew of academic literature on, say, Google Scholar. And it seems to be the case that we can understand what people meant by certain things, at least to a very reasonable and accurate degree, and we can see that they made the same delineations and that they understand, at least to an extent, the same nuances about certain topics that we understand today. You seem to be disagreeing with that, and the only evidence that you have is that I somehow haven't substantiated my position to your particular merits, I guess. But I have to be honest, I do think that I have fairly justified the position that I take.
Can I state my space now for Pat and see if he disagrees or agrees?
Real quick, because I need to translate Leo for everyone else. What Leo means when he says it seems like this, he means I've read Wikipedia and that's made me feel this way.
So now you're just going to reduce my position to sound bites because you don't have a response, or you feel that that's an adequate response?
I don't think anyone.
And I even said I'm not citing Wikipedia. Wikipedia is essentially the medium through which I am.
No, you cited Wikipedia.
No, well, I didn't because
you're hoping.
Wait, how can you cite a source that's not a source? You can't, if it's not a source, you can't cite it. Wikipedia is not a source. Wikipedia is a database of information that which provides sources. So if you want to understand what I'm saying, then just go to those sources. Don't sit here and bitch about Wikipedia. Go to the sources they cited and tell me where I'm wrong.
As a source,
I've shared my evidence. Now show me where it says that I'm wrong or that you're right. I'll wait. Don't worry, I'll wait.
Where's your evidence that
I've given it to you?
No. Where's your evidence that these quotations actually match the article?
You click
I'm just
on
going to
the
mute
article.
because I think I've justified my position. Other people can.
I understand you feel that way because you talk a lot, but that doesn't help you here. I want the actual opinion of the scientists. I don't want the opinion of someone who maybe sort of read it and then wrote something in Wikipedia.
I have a question for Pat. I think we're done with the Wikipedia thing now. Sorry, Cerberus, I didn't mean to cut you off there, but so it's 2021 now, and my issue with the way that Leo's talking is not necessarily that I'm not saying that the concept of different genders or transgender or sexual identities or any of those things didn't exist throughout all of antiquity, because I know for a fact that they did. My point in what I was saying is that it at those times, they didn't think of it in the way that we think about it here now in the United States in 2020. And my evidence for that is simply for the fact that speaking fluent Korean now, that they currently now don't even delineate between gender, aka male, and sex, as in or gender man, aka gender male, because they still use the same term nam for both. Nam. There is they don't have a sociological concept of there being a separation. They do have the sociological concept of people having different sexual orientations, people, of transgenders existing, and that type of person, but they do not delineate a difference like we do here in the United States in 2021. There. So would it be fair to say that in language, there is no way that we could show that because those types of people existed in the past, that they thought of it as a delineation like we do today in the present?
So what you're asking is whether or not in ancient societies that I have studied, whether or not every society that I've studied actually looked at this issue entirely in the same way. Greeks and Romans looked at it different than the ancient Thracians and Scythians. For example, the Scythians did not distinguish gender roles for the most part. Particularly among their priestly castes, transvestitism was a common norm and was actually a position of social status. So it's a cultural phenomenon, and typically in the ancient world, there's some, not every culture approached gender in the same way, neither did they approach gender identity the same way.
So it's not universal, it's sociological.
Cultural. Well, yes, gender
That's
is
my only point.
A largely
100%.
gender constructed, social norm.
And there is some nuance.
Gender is a normative convention that we utilize for how. So it's normative in the sense that there are sort of the things you should do. It's oughts. So if you desire to be a man, you ought to engage in certain behaviors. That's it. What you have hanging between your legs doesn't necessarily. Now we might have defined some of those oughts. Those norms might have, at least in some culturally traditional ways, been associated very heavily with biological sex. But broadly speaking, and I just want to say I agree with everything that Will and Pat had there. I was never saying anything that like the acknowledgement of a delineation between different gender identities and a difference between gender and sex was universal. There were societies that didn't understand that, but then there were societies that did have ways of understanding differences or nuances between those, which was the point that I was getting at, is that we can see an identification of more than just you're a man and you're a woman, or you're a male and you're a female, all throughout ancient society. That doesn't mean everywhere, but throughout numerous cultures in history, we can clearly see that they understood, and I'm not saying they understood it, medically or psychologically or what have you, to the degree that we do today, but they obviously understood that some people will identify differently than what some people might say they ought to identify as, or what might
but they would have
deviate
never said
from
that they
what's
were a
typical and usual.
different gender. They would say that they're that person.
We have to get
Hi,
Danny in
Uranus,
a
you're wrong
Yeah,
second.
let's get Danny
and
in.
not distinguishing pronouns in their own language. That's
But
not
I
true.
d-
Well,
I
but
do-
but my argument has nothing to do with pronouns. My argument has to do with the
I
delineation
was talking
between
to
the
Titan
ways in
instead.
which people identify and understand how they identify and what they want to be. That's present throughout the
Yeah,
whole of
sex
human
and gender.
history,
What I'm
especially
seeing,
within
though, is-
sex and gender.
what I'm seeing is actually both Leo and Will are making correct points, and they're in a way they're talking a little bit past each other, but they're actually coming to the same conclusion. Leo is talking about a variety of cultures which had addressed issues of what we'd call intergender people, or actually, people being identified based on their own personal gender identity versus that which society had constructed for them, or society being open to the point where those conventions weren't in place. Will's also made a really good point earlier. He made a comment about the advent of Christian theology and doctrine, which reduced what he called hedonism. I think that's actually a very improper use of the term, but a
Secular,
traditional
how
pagan, non-Christian societal norms within both the Greek and Roman world, which was eventually, I would say, crushed, and a new normative behavior within a Christian framework was adopted, which highly regulated
Yes.
not only gender and sex, but also what would be considered normative sexual activity within a framework that has lasted from 1700 years and was detrimental in many ways to Western culture and United States and other places in the world that embraced Christianity, because that became the social normative framework that we inherited as a society. And
Incest,
whatever
pedophilia were all
So-
commonplace.
So
Socially
is it
acceptable.
so it would be fair to say then
Yeah,
that
everybody
there were
wants to get
some
their point
cultures
on.
that had that
I can't
wanted
get
to
a word
address it and had a better understanding of the topic, versus other cultures where, depending on what they valued in their society, it might not have been as much of a forefront, like something
And
as
this
important.
will be the last answer, and
So
then
I'm
we're gonna
gonna
go
bite my
to-
tongue, and I gotta let Davey on.
I think she asked a question, or was that a statement? If not, then we're going into Danny.
Well, I was seeing
Hi.
it like Pat, if I had it
Yes.
right then.
Okay,
what
then
was
Pat,
saying.
the floor is yours, and then we're going to Danny.
Yeah, in general, Amaretto, you're right.
I call first after Danny gets.
I mean, there's a lot of nuance on this topic. I'm going to be the first one to admit that I study cultures of the Mediterranean from about the 8th century BCE through about the 4th century CE. So if you're asking me about those particular cultures and societies, I'll be more than happy to ask. But there is a broad plethora of cultures that embraced this at various temporal periods and regionally that are very different than what we might be addressing within even the Mediterranean.
I just wanted to say really quickly that, and just more of a question to Amaretto. How many times did I mention, just out of curiosity, how many times did I mention the word nuance, or that there are nuances in this?
Not once.
Oh my gosh, honey, I haven't been keeping track.
A lot. I just wanted to clarify that point.
I'll tell
You're making
you,
it
Leo,
sound like
that's
your
a
claim
nuanced
was
question.
universal
That is a
throughout
nuanced
time and
question.
culture. That's
Anyway,
I-
let's
I-
get Danny in,
I-
everybody.
Let's get
Let's get
Danny on.
Danny in, because he's
You guys are
been ready to
intruding on
go.
my time.
And it's multiplying, because then not only Danny,
Randolph.
but now we have Randolph. We're having fun. And all right, we are Midnight Ranting. Danny, I hope you are doing well. We are talking the issue of should transgender children, have access to puberty blockers. Hope you're doing well. What are your thoughts about the topic, the debate, or anything we can talk about tonight?
wind.
Yeah, I would like to take my time just to ask Will a few questions, if that's okay. Will, are you there?
Sure. Do you want me to pull you out, or do you want to?
Yeah, you can pull me out.
Pull it out, Danny.
I know. I said it, and then I'm like,
Yeah.
I gotta make the joke.
Yeah,
Someone has to. Thank you. All right.
Danny, ready to go.
Okay, Will, I have a question for you. When you, in non-coerced scenarios, right, when you use the terms like he or she, let's just take the specific pronoun he, are you always referring to someone that either has XY chromosomes or a certain kind of genitalia?
Unless I'm in a situation where there's somebody of a trans orientation, yes.
Okay, so you do use preferred pronouns?
Sure. I call Amy she all the time.
Okay, so then do you feel
She
like
prefers to be called she.
Okay,
Why would I not? Yeah.
I read from the chat that you were denying the distinction between gender and sex. Is that true?
Am I denying the distinction between gender and sex? I think that that's a social construct that applies to the culture that we're in now. That's what I believe.
Gender and sex, or just gender?
The delineation between gender and sex is a social, cultural construct here in America in 2021.
Do you think that the
It
distinction
doesn't exist in other cultures? Yeah.
Okay, so if I guess I'm not, but that seems that you're just. It seems to suggest to me that you do accept the distinction, whether it's socially constructed or not.
I accept the social norm of calling people what they want to be called.
I'm not talking about that. I'm talking about, do you think there is a distinction, whether socially constructed or not, between gender and sex?
Do I personally?
You're right.
Yeah, no, I do not.
Okay, so that means that when you're using he or she pronouns, when are you referring to gender or just or sex? You can't
gender or sex.
Okay, so they're or both. Sorry,
sex.
Okay, so by sex, does that establish a kind of biological reality?
It would be the way the person was, their biology along with their sexual organs.
Okay. So when you refer to God as he, how does that work out?
I refer to God as God. He is just because that's what's in the text.
Okay. Does it make sense to you that
I don't believe God has a specific gender, that he's a male or not. I don't know.
God just prefers he.
Yeah. That's his pronoun. Yeah.
Do you think it makes sense to refer to God as she?
To me, that doesn't matter. That's irrelevant.
Okay, so if Christians started referring to God as she, it wouldn't make any significant difference to you?
No.
Okay, that's all. Thank you.
God's God. It doesn't matter whether he's a he or she's a she.
So I think what Will's just trying to get at is that, like, for the vernacular, like from until maybe 10 or 15 years ago, anytime anybody mentioned sex or gender, was always talking about the same thing. And it's very nuanced now, where there is a there is a difference between the two. And that just seems, now I think he's fine with it. If that's the way it's going, that's the way it's going. But it is an abrupt change from how we thought about it, maybe only 15 years ago.
And there's background for that too, and for me, the reason why it's even more of a cultural shock. And Pat, was it you that I talked to about this the last time that we had a show on a similar topic? I don't remember. It was in the after show, but I'll tell it for the regular audience now. I left the United States to go to Korea in 2003. So we're talking first couple of years of the Bush administration, where this was not a cultural mainstream conversation that anyone was having. Yes, the conversation was being had. I mean, even gay rights, even just the basic, L and G part of that movement was starting to, really fight for their position and their social normativeness. And so even leaving then and going to Korea and not coming back until 2015 and being in that society where people still didn't even come out of the closet publicly in Korea as far as even being homosexual or not. So having lived in a society then that's not due to Christianity, that's due just to their
cultural
normal culture.
Norms.
Because Christianity, even though maybe the majority of religion there is still only like 25%, right? I mean, it's a small difference compared to what it is here in the US. It's just that cultures are different and cultures look at things differently. So the only problem that I have is when people make what I call like a universal assertion that this is how it is and this is fact because our culture says that. It seems very narrow to me when there's 7 billion people on this world and there are other cultures that completely disagree with everything that Leo said.
Do you think God assumed a gender when he okay, so that means that Jesus was non-binary or non-gendered, and then prior to his birth.
What?
Well, you as a Christian, you believe Jesus existed prior to incarnation.
In his heavenly form,
Right.
he wouldn't be gendered, but when he
He's
was
part of
on
God,
Earth,
yeah.
he assumed the
He
male
was a man.
gender.
Right. That's what I'm asking. Are you so you think that Jesus assumed a gender when he was birthed, right?
So God in heaven, or God the Father, is not a physical being, right? He's
But Jesus
invisible God.
existed prior to the incarnation, right?
Right. He was with the Father, yeah.
Right. So, but it was no he. It was just right. There was
He's a he
and then there was
now. He's a he now in his current state.
okay. So
because
you think that
he has a
Jesus
body.
still has his body now?
It is a well, he says as much at his ascension, right? So
Right. Okay.
yeah. So it's just by scripture, and that for me, like if you're asking me personally, my theological position is that God made man and woman, male and female. He made them, right? That's what Genesis says, right?
But that's not exclusive. That's not mutually exclusive with accepting a distinction. Like Christians can accept a distinction.
What do you mean by accepting a distinction?
Well, the idea is that they might understand the terms male, female, or woman and man just in terms of biology or genitalia, but also accept like other gendered concepts.
I think he just said he did.
I accept any gender, anybody. Look to me in my own brain, right? The way that I see the world through my theological world lens, right? I don't see a distinction. To me, there is no delineation between gender and sex. Anytime that I refer to one or the other in a normal concept where I'm not thinking, where I'm not consciously trying to be polite or politically correct, I'm not making that delineation. When I say man, I mean male, and when I say woman, I mean female.
Yeah, what I'm saying is that
my unconscious.
the text, the Bible doesn't talk about the distinction, right? It just meant it could be that the Bible, every time it uses terms like male, female, man, or woman, is referring to a biological reality, but it wouldn't therefore mean that there's no distinction between gender and sex.
So I think the term man and woman, or he made man and woman, male and female, he made them. I think that's pretty clear.
Yeah, but those could be
connecting the two.
Distinction, but it's not clear from the text that there is.
Well, I'm just saying, it could be the case that all of those terms refer to sex or imply a biological reality, but it wouldn't therefore mean that there's no distinction between gender and sex, right?
You'd have to ask Pat what the cultural view of the Abrahamic faith was on gender in that time that text was written.
I don't see how anything turns on that.
Sure, it does. If that's the intent of the person that God inspired to write that text, then that's the meaning of the culture.
I'm saying that the text is going to be compatible with like a distinction.
That's what I'm saying. You can delineate all you guys all you want to. That's what I'm saying. I don't have a problem with delineation. I don't have a problem with people thinking the gender and sex are different things.
Were you asking Pat about whether they accept a distinction or not? Is that what your question was?
I'm just saying that the delineation now is a cultural, sociological issue here in the United States in 2021 is not a universal truth.
But I'm just wondering, right? Do you think that the writers?
What do I think?
The writers of the Bible, right, accepted a distinction between gender and sex?
I would say if they did, it wasn't apparent because they didn't make that distinction.
Yeah, that's what I'm suggesting, right? Whether it could be all their terms, right, like he, she, man, woman, could just be in reference to sex, but then they wouldn't therefore imply that they don't accept such a distinction.
There's no evidence that they do, and there's evidence to the contrary when they're talking about the natural way that God made things, right?
Yeah, there could be talking about nature. Sex.
But I mean, you would never get just from reading the Bible that there was a distinction. If that's all you had to. Well, I mean, I guess that's a special pleading because he's God, but.
I don't know what you mean by special pleading. I'm saying that they're used gendered terms that don't refer to sex.
Like what?
When they refer to God as he.
Yeah, no, I would accept that.
I mean, is that the only exception when it's God?
It's the only exception I need to show that whatever you said was probably wrong.
Although, I mean, I would say that it might be reasonable for them to consider God to actually be a male.
Yeah, I don't think
like male in what sense? Like having a penis and stuff?
It's patriarchal society.
Yep.
Yeah. Not as male as having a penis, but being as a patriarch.
I think it's implausible to think that
Homogeny.
God had genitalia.
I think it's
God doesn't have genitalia. There's nowhere in Scripture that says that he does. But they refer to him as a he in the fact that he is. They were in a patriarchal society, and the homogeny of power was in the male sex.
All I'm trying to show is that they use gendered terms to refer to non-biological entities.
Right? But how is that so delineation between biological entities?
It just shows that they're comfortable using gendered terms
God.
to non-biological entities, right?
I don't disagree. But what's your point?
That's to
People do
accept
that
use
today.
gendered pronouns without
That correlation
their
doesn't
cars.
equal the
For the
causation
biological
that what you're saying is true either.
Okay, first off, do we have any evidence that they had this concept of biology? Really?
Yeah, they knew what penises were and vaginas.
Yeah, but did they have a concept of like this like living thing? And God cannot be the same thing as we are, because as far as I understand, the concept is we have His image, we're made like Him.
I think that's a question about whether they thought God had a body. Is that what you're asking?
Well, yeah, but if we're made like Him, if Adam was made like Him, right? Then of course he would have a penis.
I don't know what I mean. That is an
And I would have to
question.
look at the Old Testament, because do they refer to God as He in the Old Testament? I'm not sure they do.
Yeah.
Yeah, I think they do.
Yeah, and in fact, there's like a whole history about like one of the reasons why. I mean, you're probably
Amy.
not going to accept this. What?
Amy, after can we get Randolph in? He's wanted to come in. Maybe let Danny finish, then let Leo make a
Yeah,
statement.
I'll finish the sentence. I'll finish the sentence. Very briefly.
Yeah, Amy's coming.
There's a pretty interesting
Yep, that sounds
explanation
good.
for why they wanted.
Well, you would know,
Yahweh-
Amaretto.
They wanted Yahweh to be referred to as He because it was something like to quell like who said the patriarchy? Like the idea is that it was a way to subjugate men or something like that, which is an interesting history there with why they refer to gods as in the masculine form.
Because they were a patriarchal society. Yeah, that makes sense. That
Yeah.
they would refer to the homogeny of power in a masculine way if they're a patriarchal society.
Yeah.
Logical. That's what I said, yeah.
No, I don't think it's so important to modern day life, but I think it would have a lot of bearing because of like Old Testament laws, right? A lot of them are dependent on your sex and or gender, depending on what they meant. Like that could be pretty different.
But it was fairly clear that when it came to man and woman, that there was no distinction between male and female in Abrahamic cultures.
Okay, let's get Randolph.
And all right, guys, we are going to add in Randolph, and then we'll go back into open conversation. Randolph, we have been midnight ranting, talking about gender-related issues, but the subject that brought us here is should children, trans children specifically, have access to puberty blockers? I hope you are doing good. And what are your thoughts about the debate, the topic, or anything people have been talking about?
Well, first of all, the question you just asked, should they have access to it? Yes. I favor freedom of bodily integrity, freedom of the person and all this. So I think they should do that. I think it should be, for children, it should be kind of informed consent. We need to make sure that it is really what they want to be doing. But as I understand it, that is something that already happens. And it's not a situation where, correct me if I'm wrong, please, but my understanding is that first there's a lot of preparation for it before taking the medication, before getting any surgery and things like that. And my understanding also is that doing this at a younger age has a much better outcome in the long term for people. So I do favor it, but obviously it's not, in my understanding, not a quick decision. It's something that takes a lot of effort and care and planning and making sure that there are certain health requirements met and whatnot. So it is a long process. So I think that
the answer should definitely be yes. Human rights apply to people, I think, of all ages. People of all ages should have the right to freedom of expression, for example. So why not freedom of personal sovereignty over one's own physical body? So yeah, definitely my answer is yes on that. I think you did well in the debate. I only saw the first portion of it because I had to go and take care of some things. But I enjoyed watching you on the screen. I don't know if you noticed, but I did put some comments into the modern day debate live chat, raising.
I did. I saw you there.
Yeah.
Good. I hope that was, if you hadn't thought of it already, I hope that was helpful. I want to see you do well. So, of course, we're there to support you. And I saw Amaretto and Marshall there, so that was kind of neat because we all know each other from here. So it's great.
Had the whole crew out.
Everybody was there.
Amy.
I missed the others. I'm sorry I missed the rest of you, but it was good that you're all here, all there. So there.
I was there, but couldn't comment because I was working. So
yeah. I think you had a live stream going at the time, didn't you?
Oh no, my live stream ended at like 8 or something.
Oh yeah, yours was earlier. Okay.
Yeah.
So yeah, you can take me off the full screen, Amy. That's thank you. I like the way you introduce everybody coming into this. This is great.
So
Well, thank you so very much.
And real
Randall.
quick. So you know,
go ahead. Go ahead.
sorry. So
No, go.
to your comment, you're pretty on point. It is a very long process to get to this, and I just want to say too, like there can be cases where it is not as long as what others have to go through, and usually in cases like that, there may be years of documented like medical history, something like that, a reason that, again, you're weighing the risks and benefits, that this person may have actually been demonstrating these thoughts and feelings for way longer, and it's they have documentation, they have proof and evidence, so the doctor feels comfortable running them up the timeline. These are, taken on a case-by-case basis, and
that's good, as it should be.
Yes, it's as it should be, like definitely.
There was a comment in the chat that came up. Somebody, oh no, it was actually from the interlocutor, Amy's interlocutor. He said that he kept saying that the medications are experimental and everything is experimental. And I'm thinking, this stuff's been around for a while. I think it's pretty well understood what the effects of all these things are.
And this is the thing, we should definitely have more research into these specific topics for sure. Mm-hmm. It's just, again, as I mentioned a while ago, there's issues because of, first of all, high standards, which is a good thing. I'm not saying drop the standards, but there's a lot of high ethical standards, and even more so because these are minor children. So there's a lot more involved.
Ethical standards. That's the word that was the tip of my tongue earlier. Yes, ethical standards. That's why I'm talking about informed consent would be a part of these ethical standards, of course. So people having the information to know what's going to be happening with their lives.
So, in other words,
before we move forward, can I close a point? Finally,
Let's
take about 30 seconds to a minute. So, apparently, Cerberus went through 286 primarily academic links at once. I doubt it. I only followed up on about 5 or 6, and it all seemed to work out for me. So I took the liberty of following it up, and from historians.org, which is a magazine by the American Historical Association, it mentions that gender, while it might not be, or transgenderism, while it might not be recognized as transgenderism today, and while historically it might not mean exactly what it does today with all of the nuances that it has today, that we can, with today's terms, approximate to what people meant in the past. And I would argue that seems to substantiate the point that I was making, at least just up front. But also from sapiens.org, which is a magazine that is run by the Wenner Gren Foundation, I believe it is, through the University of Chicago, also mentions that throughout human history, we can see a clear delineation between different gender and sexual identifications that humans had throughout numerous cultures throughout history, which again seems to substantiate the point that I was making, that there is obviously a clear understanding of a difference in the way that people identify, and that they can oftentimes deviate from what they were assigned at birth, which was really the broad point that I was making. So, again, just to reiterate, it seems that academia is thoroughly on my side, and that nothing that I've said seems to fall out of line with what anybody who is an expert or a professional in the field would have to say on the matter.
Okay, it seems like
Someone call 911, please.
two magazines, and it seems
wait, hold on. You're talking about a magazine through one of the world's most respected historical organizations, and a magazine ran by the Press Institute of one of the world's most respected universities. This would be like bitching that I cited. Hold on. I didn't finish. I'm sorry. Hello. Did I cut out? Did I cut out? Can everybody hear me?
Quote the right source.
Can everybody hear me? Hello. Am I audible?
No.
Anybody?
You're
making a claim that's false. I should just let you do that?
Can people hear me? Or, hello? Okay, as I was, it's like arguing that Science Magazine, it doesn't work because it's not actually... Hello? Am I cutting out?
Hello.
Why, like, am I cutting out? What's going on?
The middle of my point was in the way of.
Hello.
Maybe let Leo finish.
As I was citing that. Well, you shared magazine. Hello.
Guys.
Cut in, and he just waiting someone else interrupting him. So I'm just going to finish my point.
Hello.
Hold on.
Am I audible?
You are audible.
Okay, awesome.
For the purposes of having a rigorous conversation, Leo's gonna finish this point, and then Cerberus is gonna be right next, who I assume's one to respond anyway. And then anyone else.
The problem here is that claiming that you cited two magazines doesn't work. It's not really an appeal to bias fallacy. It's just overly dismissive. It would be like saying that I can't cite Science Magazine simply because it's not an actual technical paper in the journal Science, one of the world's most respected academic presses, peer-reviewed academic presses. They have their own magazine, the Science Magazine. I can cite from that is considered an academic source. Both of the magazines that I cited are ran through academic institutions, and I think that lends serious rigor to the level of credence that these magazines have. And I think offhandedly dismissing them as, oh, well, you're citing from magazines, says you seem to have done nothing but offhandedly dismiss all of the evidence that I have presented for what I'm saying thus far in the discussion, seems to me to just do nothing but obfuscate the discussion. You're not actually contending with the arguments that I'm making. You're simply trying to dismiss the sources that I'm using to substantiate those points.
Well, actually not, because it was like 10% of my point, which is why I was saying you were interrupting me. So, stop berating people for doing it to you because you did it to me. I'm saying you cited two magazines. I'm pointing that out because these articles don't actually cite anything. Secondly, it seems like the first one doesn't actually agree with you. I don't know how you got the conclusion that it did, because you literally said that they didn't.
Where does it not agree with me? Can you cite from it, please?
From your own words.
Well, no. Wait. What do you mean my own words? You didn't say my own words. You said my first source. Can you show me where?
No, it was literally your own interpretation of that first source.
Wait, what are you talking about? You're referring to the historians.org.
You want me to answer your question? You want to keep on interrupting?
Because you said my first source. I just want to make sure that we're talking about the first one, which is the historians.org. Is that the one you're referring to?
Am I audible? Okay. So you said to your first source, essentially that not necessarily that they didn't necessarily understand these things then as we do now, and that was my whole point.
Well, then the way that you presented your point was very, very poor.
I understand
the point that you seem to be insinuating, and I think maybe certainly one person, but maybe more than one person in this chat would agree, seem to come off that people in history, we don't know whether they had delineations or understood nuances between gender identity and sexual orientation and things like that. I never said it was understood as it is today. There's numerous things that were understood, like geometry and algebra, thousands of years ago that weren't understood as they are today. But that doesn't remove the fact that those things were understood in those days, that they did have some understanding of the nuance and the differences between them back then, and that it was recorded.
Yeah, I just wish you had some evidence of that.
Well, I've provided numerous sources. Like, see, this is what I'm saying. You keep saying that you're saying that you fundamentally agree with me, but then saying that I haven't provided evidence for what I'm saying, indicating that there's some disagreement there. Like, I have no idea.
Which is an opinion piece, was written by someone who's specifically for that topic, right? I placed the link for the author's background.
Wait, are you talking about Gabby Hartman?
Yeah.
Yeah. So what? I'm failing to see what your point here. What's your contention with what the article said?
It was an opinion piece. It was.
What's your contention with what the article said? I don't care the nature of the article. That has nothing to do with any truth value contained within it. What's your contention with what the article said? And what evidence do you have to sufficient? No, that's for Will. And what evidence do you have to sufficiently warrant that contention? That's what I want to know.
What part of the article are you even citing?
Yeah,
I am citing. I am on it right now. Just give me a few seconds here. A significant number of archaeologists have pointed to the fact that the division of humanity is rarely binary in ancient depictions of human bodies. That would be the first sentence, which thoroughly is thoroughly in line with my entire argument. And again, this magazine is published by the press of the University of Chicago, one of the world's most respected academic institutions. Offhandedly dismissing it as this is an opinion piece is again a fallacious. You're attacking the nature of the source. Yes, it is. You are attacking the nature of the source rather than attacking any information that is within it.
Okay, first off, right now, I didn't attack the nature of the source. Right now, I pointed out that statement was neutral to your point. It does not say that that's how they understood it.
In his study of late Bronze Age figurative art in Greece, archaeologist Benjamin Alberti demonstrated that not only was genitalia completely absent from the imagery, it was also impossible to rely on a clear and systemic association of color coding, physical attributes, or clothing conventions attributed to gender, which seems to indicate that the conventions of how they dressed and how they acted and everything were not binary, were none of those things. That this is very fluid, and that they understood that there were nuances between this, and even had words to differentiate between the particular identities that existed for this time, which seems to indicate that while it might not be understood at the level of technicality that we understand it today, because obviously we are significantly more technologically advanced, that things like transsexualism, transgenderism, and gender fluidity have been known, understood, and described for thousands of years throughout human history, which is the point that I've been making. And every time you say you agree, but then ask me how I've substantiated that point. And I don't understand what the fuck you're trying to argue here.
Wait, you just used this as a source that agreed with you. I'm agreeing with that. I'm agreeing that transgenderism has existed throughout all time. You are making the distinction that those people in history had the same nuanced thing of a delineation.
No, I have
between
explicitly expressed that they did not have the same understanding that we do today, but that the understanding still exists.
Not at the beginning.
That's the contention I've maintained throughout this entire discussion.
So that was my point, and then you've been vehemently arguing.
The only reason that I responded to you is because you went after my sources and claimed that I couldn't substantiate my contention, which comes off to me as a point of disagreement, disagreement about what I said. And when I provided sources, all you did was just attack the nature of the sources without addressing any of the information.
Yeah, but you were giving those sources to argue against me, but now you're agreeing with me.
Well, I was only thinking that I was arguing against you because you presented your case in such a way that I assumed you were taking a position opposite to mine.
How about this time? Next time, talk less, hear more.
Well, I was listening to you, and it seemed quite clear that you stated on numerous occasions that I did not substantiate my contention, and that you seemed to be making the case that humans did not have, or that we couldn't at least infer from language that humans had an understanding of gender and sex and a difference between it back then. You at least certainly came off that way.
Your argument shifted, Leo.
No, it hasn't.
No.
Pretty heavily.
Okay, so what was my argument initially then?
Ancient peoples that had a clear delineation between sex and gender. That was your point.
Well, I would say they did.
Yeah.
The article just said they didn't.
Well, no, it says that it's not as nuanced or technical as it is today, but that there is still a delete. Oh my God!
A concept.
It said that it wasn't binary.
I don't even. Oh my Lord! Jesus Christ!
The literal first line
I'm talking about the understanding.
It's not as nuanced as it is today. Then it's not the same as it is today. They didn't.
Nobody argued that it was the same. What was argued is that it's there.
Yeah.
Yeah, but see, my
Of
whole,
course,
my
they were
whole
there.
thing.
There's
you
trans
know,
people exist. They
So
had a
if
term
you
for their
agree,
behavior.
why
Of
have the
course.
both of you continually pressed everything that I've said and are now bitching at the fact that I'm responding to what you said in an argumentative manner because you've continually pressed everything that I've said?
changing sides and giving bad evidence.
I
Oh my
honestly think
gosh.
that
All right.
both of you have been extremely uncharitable in this discussion, and as
I've been very
pretentious as it
charitable.
sounds, I think it's due to the fact that neither of you, can reasonably contend with anything that I've said.
I think it's,
I do.
considering that I read quite a bit, I think I would be pretty charitable.
You haven't read. How can you say that you've read quite a bit when there's all of those sources provided and you outright try to antagonize Leo and try to like saying you wouldn't do his research for him next time in private chat?
We'll
Like
not do it again.
you're not being.
But you haven't provided anything.
You're being a dick. Like,
disagrees
let me
with what
just
I've
be
said.
blunt about it. You're being a
Very,
dick.
very simply, if you have a really strong opinion and you come off like Leo, you better actually bring evidence. I'm not
Well,
doing it.
I did. And see, here you go. You keep insinuating that I made some contention I didn't provide evidence for, and then when I provide evidence for it, you claim that the evidence agrees with what you were saying the whole time, which calls into the question why you were pressing what I initially said to begin with to kick this all off.
The first magazines agreed with my position.
Where?
All the other evidence you
Where?
gave,
Because I cited where it agrees with mine from two different places.
based off what you said about it.
I can do it again too. Really? Would you like me to quote it again?
Can I
Yeah,
can I
go
can I
ahead.
say something here
I
real
think-
quick before you
I
guys
think
get into
Severus
this?
made a good point about how the articles don't include citations. That is an interesting point.
Well, it's no different than if I cited from Science Magazine, which is probably not going to include citations. This is because hello.
Because
Hello.
of the nature of the piece.
Hello, exactly. It's
It's not meant to
Science
opinion. It's not
Magazine
an
is
editorial.
published.
It's
Science
meant
Magazine.
to bring academic.
I mean-
It's meant to bring academic topics to a non-academic audience. So therefore, it is
Exactly.
not going to be. You have to consider your audience when you're writing a piece. So because it is not an academic paper, it's not going to be cited. But that doesn't mean that it's any less good of a source. If you look at who wrote the article, things like who the organization or production company of a source is, who
Hang on.
wrote the piece and their qualifications.
did I-
All this is
Did I
an
misunderstand
attacking of the
something?
nature of the source
Right.
rather than contending
Did-
with the information contained within it.
Did I misunderstand something? Like Amaretto, it sounds like you're talking about the magazine itself not being cited. That's not what I understood. I understood that the articles themselves don't include any citations.
Well, yes, the reason for that is because of the nature of these sources. Science Magazine, which is the magazine of the journal Science, one of the world's most respected peer-reviewed academic presses within the realm of the physical sciences, they rarely cite academic stuff. They have writers, contributors that will do opinion pieces. These people are generally professionals. They're very well read in their field. I mean, Ethan Siegel is a PhD theoretical astrophysicist and writes in Forbes magazine. If I cite from that on something on astrophysics, oh, well, this is Forbes magazine. What does this mean? But that's not.
But you look at who wrote the
this is
article
fallacious.
because
You're just attacking the source instead of Danny's getting a master's in philosophy. He can tell you this is a fallacy. You're attacking the nature of the source rather than contending with the information provided in it as a means of discrediting the source without having to show how it's actually wrong. I demonstrated really quickly to finish up. I demonstrated that historians.org is published by the American Historical Association and sapiens.org is published by the press of the University of Chicago. I mean, you can call into question these sources, but me personally, these sources are published by academic institutions. Why myself not an academic in these fields and not personally well read in these fields would I disagree with what actual literal experts and professionals are saying?
This is like Trumperism science denial. Like this is.
I'm not denying any of the science. I'm also not denying the article. What I'm denying is Leo's interpretation of what the article's in his.
Show me where I've interpreted incorrectly. You haven't done that.
You interpreted it correctly. How about that?
So how about I quote it again? Quote. A significant number of archaeologists have pointed to the fact that the division of humanity is rarely binary in ancient depictions of human bodies. In his study of late Bronze Age figurative art in Greece, archaeologist Benjamin Alberti, there's a citation, demonstrated that not only was genitalia completely absent from the imagery, it was also impossible to rely on a clear and systematic association of color coding physical attributes, or clothing conventions attributed to gender. You're pointing to the fact that this doesn't say these people understood this, though it wasn't quite as nuanced as they're understanding today, as meaning that they're not insinuating that. What's being understood by what's being said here is that back then we see the same thing that we're seeing today, that the way that people dress, the way that people behave, all of these things can be very fluid, that you can see people who are biologically male but might not engage in activities that one would typically associate with something like that. This has been present throughout all of human history, which is the point that I've been making. You seem to claim that that's the point that you've been making the whole time, yet every time I reiterate that point, you keep questioning why I'm making that point and the sources that I provided for it, when you then turn around and claim that they're agreeing with you. Like, I'm sorry, but you're all over the place right now.
Well, first off, wasn't that clear? Go back and listen to it.
First off, I said that what you cited was neutral to your point, but the way you interpreted it was against your point. If you want to go back,
Do you think what he said? You don't trust the article? You don't think?
Do we want to go back to something else, or?
No, I perfectly trust the article. Actually, I'm just bringing up that it doesn't agree with Leo.
You haven't cited where. You just keep asking me where I've cited that it has, and I keep stating it, but you're not providing any exact justification for where what I've said doesn't actually agree with me. I've provided a reason for why it does by drawing the very, very close similarities between behavior then and behavior now, and how we identify that behavior now and how we identify that behavior then, which seems to indicate that while it might not be as nuanced and technical today, that society still had an understanding of that back then. You say, oh, well, I was agreeing with that. And then I say, okay, so what's your contention? Oh, well, I don't think that your sources.
I don't think you know what I agree with.
I really don't.
Yeah, I know you don't.
Because you seem to keep like Mott and Baileying on me. Like you go to the Bailey and then to the Mott and then to the Bailey and then to the Mott. Like, I can't pin you down on what you mean because you keep shifting it. Like I said, you're all over the place.
You can't know what I mean because I don't really get to talk. How about that?
I'll be honest, I've been aggressive in this discussion. All right. I can be honest. Maybe, I probably should have engaged differently. But you know what? I think that you've been afforded a reasonable amount of time to make your case. I think that you're just not making it.
What do you think, Will? Do you want to get in, Will?
No, stop.
Just for me, you can go back to 1 hour and 8 minutes, or 1 hour and 7 minutes, and listen back.
Can you give us the quote?
Hold on.
And so we'll probably do this for another minute or so, but then we should probably change to something else.
Yeah,
I'm going to be honest. I would rather jump onto the actual subject than try to go through the nuances of what I said and trying to find ways to.
No, you guys are talking past each other. I think.
Yeah, no,
so
we're not going to get anywhere. Leo, we're not going to get anywhere else.
Yeah. On topic, I did have a question for Amy. So the source, or rather sources, because they did more than one study that Rob kept citing in your debate with him tonight, was the one from the GIDS, and again, I think it's the Gender Identity. What is it? The Gender Identity Development Service through the NHS. That they are just mired in controversy right now. From 2015 to 2019, 35 of their professionals quit. They faced 2 lawsuits. So knowing that, what do you think about the just the nature of the data that he presented and the argument that he made from it?
Just the entire argument of how many don't need to go on it.
Yeah.
I mean, I would have to look at it. I don't want anybody to go on pills. I was one of the people that was on Ritalin, prescribed. I think it is overprescribed. Then again, I think it does have a use. It's just, what are you trying to fix if the issue is this person, this little human, this child, has gender dysphoria? That is an option. There is, however, I would say, multiple safeguards before they get there. I feel like the psychiatrist should work hard to not want to use pills. I think, generally speaking, we don't want to... pills, surgery, all these options are generally in my opinion, the last, and I shouldn't have even said surgery because I don't believe children should have surgery. I kind of pulled out to this transgender in general. But, you know, I would have to see. I really want to get that stat verified. I mean, I really don't understand.
I can send the
Well,
literature your way.
Leah's just saying, like,
Oh,
the organization is very controversial and probably should not be regarded as a, like, well-trusted source.
Oh.
The NHS in the UK, is that where it's coming from?
It's coming from a specific institute.
I don't know.
I don't have the article in
Yes,
front of me.
it's the GIDS, the Gender Identity Development Service through I have from Pharma Technology Focus, which is through Pharmaceutical Technology, which is a very well-respected magazine in the field that talks about a lot of the problems with that particular institution and the literature that they publish.
Well,
the hell is
the UK normally keeps healthcare pretty politics free, but I mean, you can't help but pointing out that they have had conservative governments over there for probably since Gordon Brown. So that's going on almost 10 years that they've had a conservative slant to their politics. So, I mean, that could have an influence on how they're organizing their healthcare.
Exactly. And if I could just interrupt you guys for a second, I will say Amaretto and I are in I wouldn't say separate rooms. I would say she is right behind the curtain. And so that is the echo. We're trying to mitigate it, try and keep things muted. But my computer this morning died. And so Amaretto's letting me use the computer. She's letting me paganize myself right here. Yeah, exactly. God took out my...
I did want to throw out just quickly that the link to the pharma to the I put that link to what I mentioned in both the private chat and the YouTube the YouTube live chat.
Because I would like to look at this study because my whole current opinion is based off that study because I don't really have a strong opinion on. I haven't researched it at all, and I don't have a strong opinion on it.
I can also throw a link from the Mayo Clinic. I
should have used this website. I want, because of the colors and everything. I was like, should I even show it? But I went back and checked all of these sites, the pharmacology sites and the Mayo Clinic. These are all far more reputable and new than a lot of
Newsmax
studies. He was
the
showing me
Washington
the
Examiner.
Tangelo citing his own
Daily
website.
Mail, his own blog.
And I don't want to completely, we all do it. The Guardian, the Federalist, whatever. There could be something behind there, but I'm a little shady of the Federalist. I just,
I don't want federalism because federalism generally requires a state, and it is my goal to eventually work towards abolishing the state. But that's completely tangential to our discussion. Not even tangential to our discussion.
Absolutely.
It's also super impossible.
No, it's not. I would argue for more. This is the first and last point I'm going to say about it. I would argue for most of human history, and Pat, who I don't believe is in here any longer. Oh, no, yes, he is. Could comment on this and correct me if it is in fact incorrect.
You probably shouldn't.
I don't think it is.
Down that rabbit
hole. I would argue that throughout most of human history, there have been like communes and, local tribes and clans and things like that. But the states, as we understand them, didn't really arise until maybe, I think you could argue, maybe starting to get into the Middle Ages or the late Middle Ages. So I would argue for most of human history, we've lived without states. Communes, and see, it's the thing with like anarchism and stuff like that. It's not saying that you can't have communes and clans and tribes with some form of localized control, because that's always going to be requisite, especially if we want rights and freedoms and safety and everything. It's saying that it's not centralized over, it's not centralized and doesn't have some global, dominance. Those are states, at least quite simplistically.
Oh yeah, I would agree with you if we remove what is essentially what you're saying is country and nation from the equation. Yeah.
Like living without any form, like literally no form of governance whatsoever. I don't think that's possible. Because we're a social species.
Okay, so since I actually know very little in this, I want to ask a question. Right? 'Cause this is something that's been brought up by other people that I thought was maybe a little fishy, but I didn't spend the time to check into it because I didn't care. Puberty blockers. Does it only pause it, or will it actually shorten the overall puberty after you come off of it?
My understanding is that it's more of a pause on puberty. That
That's what
there,
Amy-
there can be.
No, she's.
Oh, yep. Okay, yeah. No, go ahead.
No.
Sorry.
Hey, we're all scientific skeptics here. I'm all for it. But generally speaking, puberty is the onset of those chemicals being entered into your system. And so when you block that, you are indefinitely holding back almost a waterfall of hormones. And so what would happen is whenever they go off the puberty blockers, they would start almost a natural puberty again, or whatever you would. I shouldn't even say natural. They would start a puberty. The hormones would begin to enter their system, and then the secondary sexual characteristics will just come naturally because of that, and it'll just be prolonged.
Okay, so the time period in which you would go through puberty is the same.
Yeah, because it's really just it's entering the body and it's happening on a smaller child. It's real. Transgender people really are going through a second puberty. They're going through the same guiles of what they would, just in the opposite direction. And so your body naturally always makes that. So if you as long as you take the blockers, you could theoretically prolong it forever. I think you eventually need to get some sort of hormone in you, because I think prolonged blocking of hormones without getting some sort of hormone in you is not good for bones and stuff. But yeah, there's nothing theoretical. It just starts. It would just start again, or for the first time.
Can I clarify a comment that was made by Hannah Anderson? She said it's really a hormone blocker, and I wanted to say that I actually agree with that. It is there are, because there always is. We've been talking about it all night. Nuances contained in that, but for the most part, that's really what it is. It's preventing the hormones that your body produces from having the effect that they normally would in the development of your body through what we call puberty, and so they sort of put a pause on puberty, so we call them puberty blockers. But if you took them from the age, like, say, 12 to 17, and then said, you know what, no, I think I am comfortable being a man or a woman, a male or a female, and you stop taking them, you would eventually develop to look like a man or a woman. Very rarely, yes, there can be some instances where there might be some side effects. They don't seem to be extraordinarily severe or life-threatening, maybe problematic, but again, we can look at pretty much every pharmaceutical, every medicine out there, even, ones that are naturopathic, like people want to use cannabis and things like that. There are going to be people that have very negative effects, whether detrimental to their health or just negative effects from utilizing these. And I think that if there's still a very, very broad and demonstrated utility and benefit from you utilizing this, then we should continue to do that, and at least to some reasonable extent promote it, at least in the sense that it would need to be promoted.
Yeah, it's risk assessment. You are weighing the pros and cons every single time, and doctors go over this, and this is why, like, when you pick up your drugs from a pharmacy, you have to sign whether or not you've been counseled by the pharmacist, or if you decline to do so, this information is offered to you. It's not that,
like with cancer treatment.
Yeah.
You could die, but it could also save your life. It's about a 70-30 split. Most people are going to say, yeah, let's go. Well,
let's give it odds. May the odds ever be in my favor. Let's go.
Yeah. I mean, it's the same thing. Yeah, it's risk assessment.
Yeah. So, and these aren't decisions that are taken lightly. So I think that's what a lot of people are forgetting. And especially because this kind of thing, it's not, people take this seriously because this is a huge thing for very many people. And the fact of the matter is this can be a very lengthy and expensive process. Insurance does not cover things like gender confirmation surgery, typically. So before, like, setting somebody on this path, the medical professionals involved, they do a lot of screening. And in some instances, there are way too many hurdles. And again, like I mentioned earlier, if someone seems to have bypassed some of those hurdles or have gotten sped up in the queue, it's because there's a good reason. They have convinced enough medical professionals with, maybe the documentation and journaling or a recommendation from somebody. These aren't decisions that are just, yeah, we need to create more trans people. Let's go. Like, you're trans, you're trans, you're trans. They're not giving out puberty blockers like it was Ritalin. Completely different situation.
Exactly. Yeah.
Yeah.
Yeah, but that's sort of the thing that bothers me. Like, so they're not giving it out like Ritalin. They're going through all these steps, but they're having upwards of a 90% false positive rating.
Yeah, I don't know where that 90% comes from. Is that from kids who have
and this is the thing,
studying,
like,
or is that
this
the ones
is
that
it
the
this that paper
psychiatrists
was
are
done
able
by
to
an
filter out?
organization that essentially may have been that's now in question because of
academic fraud.
Yeah.
That's essentially what the controversy is really over.
And it also seems like what it sounds like might be happening is, the huge turf problem that they are having over their trans exclusionary problems might now be trying to actually put up barriers. And a lot of people in the UK and Ireland have said this, that they are trying to actively institute more barriers now. It's the same argument that's going on with like transports here in the US. What can we get away with? It is not, they say it's like, trans people are not covered under Title IX or whatever it is, for sports and stuff. So they are trying to see what avenues they can take to make it harder on these people because of their personal bias and transphobia that these people should not exist.
You took the words right out of my mouth. Like, I was about to say, what country do you most associate with TERFs? I mean, think about it. We all know the answer.
That is true.
Yeah, like and this is the thing, I've engaged on this in Twitter, and this is how I know. And this is the similar things that the people, a lot of actually Gen Z Twitter, like lesbian Twitter is throwing out there now, trying to say M-spec lesbians aren't valid, and that like a lot of us are older than them, and they're like saying, yeah, no, it's our word, when they're ignoring documented bi lesbians in the 1970s. And even Sappho was technically was a bi lesbian.
Yeah,
so,
not
but
lesbian
it's this,
enough for him.
But this is the thing. Yeah, it's like pure. It's like, but this is the thing too. Here in the U.S., lesbian separatists kicked the bi lesbians out, along with transgender women. There is still, if I remember correctly, a lesbian centric festival in like the upper Midwest or something, and they specifically say no trans women. It's like, this is like, it's almost like a lesbian purity card. And if your vagina has even come close to a penis, and or was one at one time, they don't want anything to do with you. It's
why it's happening.
They don't want to see you, Emery.
We're getting a smidgen off subject here because I am trying to be convinced here, right? But like some people, like, because it's political, it's a political hot topic. I can't take that. There's some people that find it contentious, right? I need to see another study that says that they're finding that goes against their findings.
Because I would be very surprised if there is 90% false positives, and that's allowing it to be.
That
just sounds like a scandal.
They're playing with those stats.
Right. Well, their stats, like I think the article said, was it 78 to 90,
something like that. Yeah.
Depending on how you ask the questions in the survey.
Yeah.
See, the problem I have with that. Oh, sorry. Go ahead, Amy.
Oh, no. Well, the other thing, I would like to see how the statistics come out, but as far as experience, I just know that it would have made my life so much easier if I had been able to. I'll probably need.
And we know so many people like that.
I like the way I look, but just like I am, I was spending just thousands of dollars and just all this mess, and even I lucked out. There's even
so Here's the thing.
We've had so many people who didn't have even a myodicium of support that Amy had. And mind you, like Amy did not have the benefit of puberty blockers, I guess, because of her path, you know, into finding out who she was. And also the fact of the matter is like, that was like, you know, we were 18, 19 around like 2007. So like at that time and place, there wasn't as much progress on this, on getting hormones to the younger generation, like, you know, or younger ages.
And I would do
just let me put a bow on it, is that the entire goal is that I want to eliminate those false positives. That's been kind of my thing, is just, you know, we want to have a child, see a psychiatrist, and basically, to the best of their ability, get rid of all, like, we don't want people to go on any pills or to transition. In my opinion, I mean, it's just about getting people to feel comfy in their body. And so, I don't know. It would be very, very surprising to me. I feel like I need more than one study. Because I've seen this done with creationists who quote atheist evolutionists for creationists. And so it would just be very surprising to me if
Hearing a
in
bit of
Western
an echo.
countries. Oh, it's because Amaretto. Oh, there you go. See, we're sharing a room. It's
there we
okay,
go.
baby. Mwah. But
I thought
yeah,
I fixed it.
but that's my main thing. It sounds a little turning the frogs gay, even though I don't want the frogs to be gay, if that makes sense. I don't think there's a 90% false positive. If that's true, I want to know about it, but I don't think that is true.
Well, I hope it's not. Let's just go with the lowest number they have. Let's just say it's like a 70, even though there's like a 70 something, right? Because it's only one study, but it's the only thing I have to go on. What it comes down to for me is how many people. If I was handing out the pills, right? If I was the person actually handing them out, how many people am I willing to harm to save someone? And 7 to 1. It's not good numbers for me.
I wouldn't
and
even
know
say it's
Leo
doing people
wants
harm.
to say something. I would say that is also another linchpin. I think, you know, we shouldn't be. You don't want to give anyone pills, but as far as pills go,
These are not
these are the
super
least
harmful drugs. These are less harmful than my immunosuppressants. And
I guess that
a lot of
doesn't
other drugs
sound
people
like a
take.
good pitch. We're saying the least amount, but it's true. I guess in life you just take so many pills, and I know from experience that of all the shit, you know, I take for epilepsy and all this other stuff, it just least amount of stuff. And I'm sorry, Leo. I know you wanted to say something.
Yeah, no, it's all good. It's your channel. Shit, you're day spoon coon in this motherfucking jungle. That's for sure. There were 2 points that I wanted to make.
Thank you for recognizing, Leo.
Yeah, 100%. And this is going to sound very hypocritical, but I'm going to explain why it's not. So I know I said that you can't just dismiss a source based on the nature of the source, but there's a difference between citing sources that are rigorous, accredited, and well recognized as being both by academia, and
Like
maybe some people disagree, but for me, academia is the standard, and I think that for most people, academia is the standard. You can't get better than citing academic literature. Now, that doesn't always mean that it's correct, but it's the standard anyway.
Dr. Hovind.
I'm digressing.
Here.
So the thing with GIDS is that they've had 30 from 2015 to 2019, so it'll be anywhere between 3 and 4 years. They had 35 of their researchers quit. They faced 2 lawsuits. They're mired in controversy for their methodologies and potential interests that they may have, especially with their relation to conservative aspects of the government of the United Kingdom. So to me, that's different than other sources that we would otherwise consider, given that they had the at least face value sort of position that GIDS does. But I think that even if tomorrow it came out that Nature Journal had, for the last 10 years, been pushing information that contained some particular interest or bias, and they had hundreds of researchers and hundreds of not publicators, what are they called, people that reviewers and everything quit, and they were facing lawsuits. I think most people would reasonably say that's probably not a source we can really trust anymore. And I think even though previously it was considered one of the single most rigorous and accredited academic presses on the face of the planet. So to me, there is a sense in looking at sources and the nature of sources, but when there isn't anything that directly indicates that the source should not be considered rigorous, then I think it should be. But in instances like this, I think that it is very reasonable to call into question the rigor and the veracity of the information that is being shared by the source. The second point I wanted to make was as to the data. Now, this isn't on specifically puberty blockers. This is on gender-affirming surgeries, people who surgically transition. I have two studies here. The first one is from 2018. It is, from August 2018. The second one is from March of 2021. These are both published, peer-reviewed in PRS Global Open, which is just a publication. And they show that with gender-affirming surgeries, in most instances, in practically all instances, the number of people who regret transition is 1%, if not less than 1%. The first one is a survey. And I don't know if it was in this discussion or if it actually, no, I think it was in the debate that Amy had with Rob. Rob talked a lot about surveys, didn't he? If I remember correctly. Well, this is a survey of approximately 23,000 patients. This is a massive survey of data, and I'm going to post it in the private chat and in the YouTube chat. And this is where it shows that regret of transition is so low it doesn't need to be reasonably considered. And there's another one that's from 2021, regret after gender affirmation surgery, a systematic review and meta-analysis of prevalence. So this is an academic meta-analysis that comes to almost exactly the same conclusions. And again, while this doesn't address particularly puberty blockers, I think it makes the broader point that people who are actually transgendered, it is extraordinarily rare that they regret the decisions that they've made in terms of things like taking puberty blockers and getting surgeries, which is an argument that we hear frequently from those who are much more right-leaning in their politics.
Oh yeah. Well, I would say, I mean, as long as you're an adult, right? I wouldn't care if half of them didn't regret. I wouldn't care if half of them regretted doing it, right? I'm not actually concerned with adults making bad decisions, especially if they're not.
I agree with that.
Right. I'm only worried about
as long as the bad decisions aren't harming others. Then I do worry. Naturally.
Well, I guess. Yeah.
Yeah,
I'm fine. I'm actually fine with people harming themselves. In most cases,
themselves, yes. I mean that's you. You have autonomy. So, but other people, no. That's where I draw the line. Anyway, I'm sorry. Continue.
Well, yeah. Well, all I was saying is, I mean, it's a little. I mean, I agree with all this. If only there was a way to like inject someone and it changes their XX to a Y, or their XY to a XX, and their whole body changes. That'd be perfect.
Well, I mean, I guess
but
in a sense that would be okay, but at the same time it wouldn't, because generally we're not, when we talk about these things, we're not referring to sex or to genetics. We're referring to the way that somebody wants to essentially sociologically identify the way that what do they want to be recognized as a person in the society that we live in. And I just wanted to say,
sorry, Leo, I just wanted to jump in. Expression is more important than any correcting or whatever we want to, whatever methodological point we want to make as far as, medical transitioning is an important thing too. But I think if societal norms were such that there wasn't such the pressure to conform, I think this would be a question that's greatly alleviated within our society. And again, I'm just going to go back and be quiet, but as the person here that really cares about the anthropology, particularly on this subject, I wanted to make two recommendations for anybody who may I talked earlier about the ancient Scythians and some issues that they had. I'd like to recommend Barry Cunliffe's book. It's The Scythians, Nomad Warriors of the Steppe. He covers quite a bit about gender and identity there in one of his chapters. But I would recommend, if anybody really wants to get into the nitty-gritty on this subject, I'd recommend the following text. It's by De Gruyter. It's Identity, Ethnicities, and Genders in Antiquity. It's edited by Jacqueline Farber-Saris and Allison Keith. And that was just recently published in 2021. And I have not read through all of it yet, but I have read through portions of it. And it's an excellent examination thus far on the most current literature on the topic. And with that, I'll go back and hibernate.
Well, I haven't read the book.
Thank you so very much, Pat.
I would agree with the first part of what you said. I just think so. From my understanding, right, a lot of the stress transgender people have is that their biology doesn't match how they want to express themselves. Am I wrong about that?
And I wanted to comment. It kind of answers that and the comment before. And Amaretto, hi. Which is that it would be nice to change my chromosomes and all that, and just like to have all of it flip. But for me, the goal is the alleviation of gender dysphoria. In a weird way, you know, you could say in some way no one has truly ever done transitioning, but in my eyes, I have done the vast bulk of what it took to alleviate my gender dysphoria. It took a while to get there, and it was a journey, but at this point, I feel comfy in my body. Like, I don't feel like I am stuck in someone else. It just feels like I'm Amy. And so...
Unless you are actually stuck in someone else.
That is when I understood that point after having a discussion with a few friends of mine that were transgender.
Part of you and somebody else. I mean,
it's the mental distress, this rather psychological distress that results from those feelings, those dysphoric or dissonant feelings, is one of the biggest things that, you know, I recognize that my genetics can't change, but if there are things I can do that alleviate I would argue exclusively negative feelings that I have, I want to pursue those. And once I had learned that, because before that I didn't think that something like, you know, Medicare, or, you know, if we had a universal healthcare system, should cover something like transition. But now I do, because it would most literally save lives. How can we not consider that healthcare? It alleviates a psychological disorder. How is that not healthcare? It makes no sense. So, and the other thing I wanted to say, and I dearly apologize to both Amaretto and Amy if this sounds overly essentialist or reductionist, but I think it's a way of wording it that at least colloquially can help people understand why it is that transgenders want to be who they are and be accepted for that. Is that you can sort of look at life like a play, and all of us have a role to play. But the thing is, we get to choose that role. And some people's roles might not align with what the societies that we live in have typically
have role
ascribed
conflict. And gosh darn it, I covered this last semester in sociology, but yeah, like there's a literal sociological theory on this, and it's, you know, you're looking at it like a play, and you have different like masks or you know, the whole
we all wear masks, metaphorically speaking.
Yeah, like, you know,
name that movie.
Oh my gosh, I can't even. But
The Mask with Jim Carrey. Hell yeah.
That's The Mask, Jim Carrey.
That feels so long ago. I feel so old.
97?
What was that, like 92?
Maybe it
No,
was
I think
92.
it was-
I hadn't even hit puberty yet.
Oh, Jesus. I wasn't even born yet.
Oh my
It
goodness.
happens to us all.
Right? talk about born in the wrong body. I'm born in the wrong time period.
So like I've been sitting here searching for other studies and I just can't find any. It bothers the hell out of me because like zero studies makes me even less comfortable with it. So I guess I don't know what to do. I'm just stuck.
What particularly are you searching?
Just other surveys or studies that show like the success rate in identifying like temporary and permanent dysphoria.
See, it's my first time coming across that point. I thought he was going to bring a whole bunch of other things. I don't know if that was like he heard my stuff in the intro, so he went
Other kid?
elsewhere. I'm just used to the get off of my taxes and why are you going to try and get my kid to cut his arm off and why are you trying to sell your gender critical stuff onto my child? Why are you like, I'm used to just a lot of other, and this was just very much focused on, I guess, that one point. But I'll have to look more.
Can I, for on Cerberus's behalf, I went to Google Scholar and typed in gender dysphoria and surgery, and I'm gonna link you the results. And just so I'm not citing any of the literature, just for your own sake. If you want to go and look at any of that, I'm gonna post it in the YouTube live chat as well. You can go ahead and take a look at that.
Oh, you know, I'm totally for surgery.
Yeah, well, I just because a lot of the papers, especially given some of the titles, seem to talk about how it can play into sort of, I'm not going to use the word cure, treatment. Yeah, that's what I'm thinking of gender dysphoria. Or you can go into the search bar yourself and type in whatever you want, and any academic literature that's out there that's, I guess you could say, public access should come up.
Right. Well, I mean, I work at a university. I get behind essentially all paywalls. I just have to log in and have the reference number.
I'm a student. I could do almost
Scholar.google.com. That's what I tell people to use. If you're looking for academic literature, scholar.google.com.
I guess going forward, right? I have an argument that I'm going to have to actively try to disagree with. And that is, how many people is it okay to poke in the eye to alleviate my stress?
At the same time, how many suicides are you willing to take?
And I will press back a little bit, though. What do you think is happening to this bigger population? What do you think is happening to them?
Well, I mean, I guess that what I've seen from what's been said in here and what's been posted over here, at minimum, some percentage of people have issues with their bones. And it seems like, based on what Leah was saying, that that they don't actually stop the process your body goes through in puberty. They stop the hormones from interacting with your body, which, at least tentatively right now, that makes me think that they actually do shorten puberty, which I think is a whole other issue that's probably not good for the people that have it happen to them.
What do you mean they shorten puberty?
It cuts it off so that they don't experience it.
Okay,
it doesn't shorten puberty, because they will still go through, if they go off these blockers, they will then go through puberty.
Their body will start making hormones normally, or rather those hormones will interact with the body in the normal manner, which will start to affect and start changing again the body, now that those are being actually introduced in ways that they can have an effect.
Okay, so I could be wrong about it because I'm not a biologist. From my understanding, that there are separate mechanisms from what is considered puberty itself that determines when puberty ends. Right, so your body will start producing the hormones during puberty, and at a certain point, regardless of how developed your body is, it will stop.
No, the puberty is just more of an increase in the testosterone and or estrogen production in the human body I guess you could say informs changes in the body based on the particular dominance of the hormone.
From my
But-
understanding, it's not a you have until this age to get through your puberty or you're shit out of luck. Like,
Yeah, it's not an age, right? But what's the mechanism that ends puberty? From my understanding, it's separate
don't
from
know.
Probably something in the pituitary gland. I would think that's where most of the hormones come from.
Like,
Yeah,
is it based off feedback? Like, does the amount of development, is that what stops puberty, or does it stop on its own naturally, regardless of how developed you are?
I think puberty stops not necessarily because there's some process that happened that is now ending, but because some process started as a person ages that continues as they age, and it causes some changes, but eventually the ability of it to cause changes eventually plateaus just because the changes are already there.
And
So you
different things
can't.
can affect puberty too, because in fact, children are experiencing puberty earlier than, even my generation right now.
Hormones in the food they eat.
I
No,
also
it's
think
not.
you're reframing it wrong. It's like I said, it's more you need both hormones throughout your entire life. You should have a main hormone, because even if you have a lot of testosterone, you still have a little bit of estrogen. But someone, if they are going to be 6'2" with testosterone, they're going to have that limit built in genetically, and they're going to be only able to go 6'2", no matter how much testosterone. Now, I really don't think that it's like it just ends. You still need testosterone throughout your whole life. In fact, I think what you're really asking with women is really menopause. That's when the hormones start.
Well, kind of, but it's my understanding that the puberty, there's a hormone spike that actually does drop off a little bit afterwards. Like there's a spike in between, and then your average level after puberty is higher than it was before. But it's not as high as puberty.
Yeah, which if somebody took puberty blockers, once they stop, the hormones will readjust. Because if you're, the fuck, dude.
Well, what I'm asking,
if you're assigned male at birth, if you're assigned male at birth and you take puberty blockers at start taking them at 12, and then you hit, let's say, 19, and you stop taking them, while you were taking them, the amount of testosterone that was produced was suppressed. So was the amount of estrogen, which doesn't really matter all that much. But once you stop, those are going to go up, which are then going to inform changes on the body that are going to begin to make you look more like a male than you previously did.
Yeah, we judge using secondary sexual characteristics. And I believe there's also something called the Tanner scale. Yeah, here it is. The Tanner scale is a scale of physical development in children, adolescents, and adults. So you're using visual cues to kind of signal, when you're probably done with puberty.
Well, yeah. We're not going to do blood tests and like gene therapy or something to figure out.
But it doesn't. There's nothing in the literature I'm finding online that suggests that it's not like, oh, you only have until you're 21 to get through it. No, your body is going to readjust from after the puberty blockers and then kind of go from there. It doesn't seem to do long-lasting permanent damage to anything hormonally. And again, the risk assessment, human beings are really complex, and thus why, they do these studies and see what the potential side effects of all these medications, not even just puberty blockers, of even, your psychological drugs, your, ADHD drugs, birth control, my rheumatoid arthritis medication. They go through and test these things to see what the potentials are. They try and use as good of a sample for the general population as they can. And there's clinical trials. So, we can't say 100% just because everybody is different, but we try to, within a reasonable scope, that's the whole part of doing research. You try to get as reasonable and as accurate as possible a result on a smaller population, so that, mind you, the smaller population that has consented to be part of this experiment and knows what might be the potential risks and stuff like that, So you're just trying to get as good data as possible so that it can either be a standard of care or not. And unfortunately, you know, this is a very polarizing issue. And so you have a lot of people that I think are set out to find or manipulate the data to confirm they're already, you know, inhabiting biases, you know, on their, you know, their own opinion on the subject. So that's just something to keep in mind.
What I'm trying to figure out is, but my understanding, all of those sex characteristics, right? Not necessarily for like penile size, testicle size, not really breast size because that can change based on anything. But where the breast is set on the person can change based on puberty. Will those things develop differently because you're avoiding so much of that spike that you would normally get in puberty?
There doesn't seem to be any literature.
Yeah, there doesn't seem to be anything that's confirming that, you know.
So that's another thing that bothered me. So there's no study on it, which I guess is reasonable, being that it's fairly new and
it's not that there's no study on it. It's just that studies done on things that are concerned with that or related to that don't return those particular results.
Yeah, and I think the fact of the matter is that, you know, it's, if you're talking detransitioners, the rate of detransition is very low.
Oh, no,
and for a lot of those cases, it's not a matter of regret. It's a matter of sociological, like not sociological, I'm sorry, social pressures, problems with family not accepting them. I know one person currently going through this because their parents, you know, don't want to talk to them. And it's breaking their heart because they were super close with their mother. You know, or financial pressures. It's expensive to be trans. And for a lot of people, I know one person who refuses to transition because they don't think that with the current state of plastic surgery and medicine, they can reach their ideal. So they just choose to not transition. That doesn't make them any less of a transgender person. So these are factors you also have to keep in mind as well. So at this point, why, if the minority of transitioning, like people who with transition regret, is so low, it's going to be very hard to study these kind of things because there's not going to be enough of a sample.
Well, the thing I'm talking about isn't actually the transitioners. Right,
You're talking about the people who detransition, who stop the puberty blockers, say, nope, I want to go back to my regularly scheduled puberty, right?
I guess I wouldn't consider just going on puberty blockers to pause puberty as transitioning.
Well, usually when you go on puberty blockers, you're still transitioning in a sense, you know.
I think the idea is that you're going to transition, maybe, and that's why you're on puberty blockers.
Usually you're on puberty blockers, yes, because of that, but they also, honestly, for most trans teens, they still go on presenting as the gender they want to present as, that, you know, is likely not the one they were assigned at birth. Like, that doesn't, it's just puberty blockers are almost a way to make the cis people feel better, to be honest.
Well, I don't care about them feeling better. Like, I don't care about cis people about how they feel about how someone looks around them. Right? I'm not worried about that. Those people can screw off if they're really that worried about it. But what I'm concerned, like, so I'm looking to see if there's a study that looked in to see if there's a noticeable difference between those primary sex characteristics for people that went on puberty blockers in comparison to those that didn't.
Are you talking, Amy?
Do it to me, baby. Sell me a quality muffler at a reasonable price.
And I will say,
probably time to,
yeah, we are about to start outros. It has been a lot of fun and insightful. I think this was a good conversation. And all right, guys. With that, I think we're going to bring in the mimes. And I'm sending love to all of you out there in chat land.
Actually, transgender mimes.
Transgender mimes. Well, we're not assuming it, though, but we accept everybody. Woohoo! All right. We have been having an interesting, insightful conversation. I hope you guys all had fun. We're kicking it off. Randolph, we have been talking about should transgender children have access to puberty blockers. I hope you had a good time tonight. Where can people find you, and what are your final thoughts? I could not agree more.
Fascinating.
I think we made Randolph.
Randy,
That's okay.
I agree
That's
with
okay.
everything
We're
you just
gonna.
said, Randolph.
I know. You know what? He was bold. He was controversial, but he went there. And we'll come back to Randolph. But Pat, we have been having a conversation. Should transgender children have access to puberty blockers? I hope you had a good time. Where can people find you, and what are your final thoughts?
Well, my final thoughts are much like my statement upon coming into the chat. I think again, it's a very sober question. I think parents, children, and professional medical care providers should have a detailed, in-depth, and protracted discussion about it before any decisions being made. But ultimately, I think it can be useful in some cases. So for that reason, it shouldn't be barred from use. So I'm just glad that you guys had me on tonight. I will just say, if you want to get hold of me, you can get hold of me at Pat Lowinger at Twitter. And I was reviewing my notes for an upcoming production with Amy, which she'll be probably, and James, which will probably be releasing in a few days. So until then, you guys take care, and I'll talk to you in a bit.
No, I don't take responsibility at all.
He never does, never does. And thank you so very much, Pat, who always takes responsibility. And we are moving right along to Will. We have been Midnight Ranting on whether transgender children should have access to puberty blockers. Hope you had a good time. Where can people find you, and what are your final thoughts?
Yeah, no, I always have a good time being here. I think sometimes people misrepresent my position or necessarily don't listen to the words I'm actually saying. But my point of view is, as a libertarian, I am 100% okay with people expressing themselves however they feel, and if expressing yourself in any way that you feel makes you happy, makes you feel whole as an individual, I am honestly and genuinely happy for you and support you 10,000,000%. Yeah, I have no problems with that at all. And when it comes to the topic of the debate tonight, like I said when I came on, as long as the child is making an informed choice on their own, and the doctor is certain that this is going to help this individual, I have no problem with him doing that from a libertarian point of view. The only caveat to that is I would hope that that it's made very responsibly and very carefully, and not as a first choice, but as the only choice available in order to fix the problem. Because I'm totally about people getting the help and the healthcare that they need. So, those are my views on things. And I see Oz is there in the chat, so we'll throw this up there for him.
Sit down.
But yeah, it's been a great show, and I've got some stuff for the backstage, but other than that, I'm good.
Thank you, Will.
Thank you so very much, Will. And that's right. Sending love to both Grumpy Old Cuss and Oz. Woohoo! See them both and everyone in chat. And all right, we're moving along. Thank you so very much, Will. Leophilius. We've been having fun. Or learning insightful things. I hope you had a good time. And what are your where can people find you? And then what are your final thoughts?
He's on Otangela's channel a lot, right?
A role play. Oh, you're muted. You're quoting me.
Yeah, I'm muted. Yes. I shouldn't be anymore though. Let's hope it's working. Yeah, no, I've never been on any of Altangelo's like 2 or 3 channels that he has. So I don't know if I would go on. But I can be found on my YouTube channel. You just type in my name, it should come up. You probably shouldn't subscribe. That might not be a very good idea. You can find me at the channel Answers in Atheism with Speed of Sound, who is a good friend of mine. He does a weather report every Monday through Friday, and then on Saturdays does a Saturday Night at the Atheist. Lots of insightful information, especially about busting young Earth creationism in general, as well as intelligent design, and the somewhat almost humorous arguments that they make. In terms of the discussion that we've had tonight, I thought it was intense yet fruitful, and I think, as Amy said, I think a lot of people, myself included, learned a hell of a lot in this discussion. I do want to apologize to both Amy and James, our lovely and gracious hosts, if I got out of hand, which I'm sure I probably did. It gets really frustrating when you have people jumping back and forth on points that you're trying to make, or that they're trying to make. It can just get yeah. Anyway, as far as the topic of puberty blockers and whether transgender children should be allowed to have them, should be allowed to take them, I think that when we examine the literature that we have available to us now, and we examine what the experts and the professionals who are accredited in these fields and who know what they're talking about, are literally trained to know what they're talking about, and engage in these kinds of diagnoses, I think we should consider their word. And when they say that this is a reasonable treatment that is not been shown to be meaningfully harmful in any sense broadly, that we should utilize those methods to ensure that people can live the happiest and the best lives that they can, as we've always done with all forms of medicine.
Woohoo!
Thank you, Leo.
Thank you so very much, Leo. And all right, we're moving right down the line. Severus, I keep on saying, I can't help it, it's my normal tagline. We've been having an interesting conversation. I hope you had a good night tonight. Where can people find you, and what are your final thoughts?
Well, I guess I'll give this again, because I always give this. You can't find me, I find you.
Woohoo!
I guess my final thoughts is I'm a tentative no, like a real tentative no. I am so close to neutral on the subject that I don't think I would even argue a no. I'm literally in a state of waiting for scientists to get their heads out of their butts and do more studies. I'm not really comfortable with this going off doctors' opinion on this, because doctors in general have a really bad track history with this, like sexuality and gender. I mean, we used to electrocute gays, try to cure them, all sorts of crazy shit like that. So I want data to change my mind. Like, I guess the last thing I'll say, if anyone's out there is interested in seeing me and Leo agree on things a lot, you go over to Speed's channel. That's it.
Woohoo!
Okay,
Well,
thank you,
you
Cerberus.
so very much, Cerberus. I know, it's politics, baby. It does it to you. It does it to us all. That's why I think, Jay, we love religion here. We love to stick to easy, nice, simple topics like religion. Thank you so very much, Service. And okay, we're moving along.
No.
Just a few more left. Amaretto. We've been having an interesting conversation on whether transgender children should have access to puberty blockers. I hope you had a good time. Where can people find you? What are your final thoughts?
So you can currently find me screaming at lesbian separatists on twitter.com at Amaretto Kitten. Happy Pride. Other than that, as far as the topic goes, yes, and hard yes. As somebody who is trying to be like a gender and sexuality specialist, this is something that's kind of important in the line of work that I want to go into. And I think that it's a topic that unless you are intimately involved in a positive manner with someone who is transgender in your personal life, that you probably don't have a lot of answers. And it's probably easy to fall into propaganda traps and misinformation traps. And I think, here in the United States and in other areas that are having problems with trans exclusionary people like the United Kingdom and Ireland, it's very easy to, be subject to misinformation about how things are, like the reality of some of these subjects, and to go along with what people tell you. And nobody likes to be wrong, but the fact of the matter is that there are processes in place to help determine if you should go on puberty blockers or not. It involves multiple medical professionals of varying specialities. There's likely an endocrinologist involved. There's psychiatry that's involved. You have to actually be, under treatment with a psychologist or psychiatrist in order to get a recommendation to even pursue puberty blockers or hormones here in the United States. And at no point does the standard of care involve gender confirmation surgery for minors. All the processes that are, offered to minors here in the United States and abroad are deemed to be reversible because of the nature of the fact that we're dealing with minors. But I would say, keep in mind that it's not doctors just pushing pills at kids. We're not out to trans your children. But, I can say that as somebody who has experienced dysphoria, that's a terrible thing to go through, and it's an expensive process to go through to mitigate the effects of it. And I'm not even, assigned male at birth, transitioned to female. I'm someone who was assigned female at birth, but because of the negative effects of, male hormones, I'm dealing with some of these same issues. So in a lot of women who are, assigned female at birth, people who have PCOS, it's the same thing. Yet it's more socially acceptable for us to seek treatment to resolve these things than for other people, than for transgender people too. And it's a very devastating thing. I can't even begin to say how traumatic the facial hair and some of the masculine secondary sex characteristics have been on my life. And I'm somebody who's non-binary. Just imagine. And there's a lot of people that can empathize with transgender individuals in this. Furthermore, these puberty blockers are also given to cisgender people. They are given to cisgender people who experience early puberty. Typically under the age of 9, I believe, is one document I pulled up earlier. So one of my arguments would be that a lot of people who are against transgender children being prescribed these hormones have nothing to say about cisgender children being on these hormones. And they can't even address, a lot of them don't even address that, or if they take a position, it sounded like Rob earlier in the debate was saying that he was against it all. At that point, I would say, where is your medical degree? why are you discounting the professional opinions of people who have studied, extensively in these fields? We can't go in with the assumption that all medical professionals are corrupt and just trying to get people hooked on money. If we're being absolutely honest, a lot of that is a problem with the HMOs as well here in the United States, and for-profit healthcare, for things like Ritalin and Prozac. But at the same time, though, that doesn't mean that those medications aren't useful or valid, and it doesn't mean that all medications are like that. And the side effects and risks are there. However, I don't know. I feel it's like puberty blockers are getting so much pushback when there's other forms of medication that, the side effects are worse or extensive and we don't question it. Female birth control, for example. Or hydroxychloroquine. I take that for my rheumatoid arthritis. Methotrexate. There's a lot of side effects that can happen from some of these immunosuppressant drugs. And they're not subjected to the same propaganda and scrutiny by the general public. So, I think we definitely need to have more studies done. I am all for having more information. But we have to make sure we're doing it in an ethical way, and always consider your sources, and don't be afraid to double or triple check, what's behind a literature or a published piece or report, because as we've seen with, certain things like vaccines cause autism, and I believe his name was Wakefield, discredited later. You always have to consider, the biases and the sources and stuff. But overwhelmingly, people do not want people to transition if they are not sure. And that's why there's these rigorous processes, especially for children. So if anything, I think, in places like the UK, there are more barriers that are actively being put up to be put in the way of transgender people from receiving affirming healthcare. I think we should be finding a lean towards helping people, because at the end of the day, I would rather have you alive and maybe having one or two side effects than to have you be dead, to have you be like Miss Leela Alcorn and feel like life is hopeless, your family does not affirm you or love you as you will never get to be who you are, and you go in front of a semi-truck in the middle of the night to kill yourself. No one should have to feel that way. So if it saves one life, I think that this should still be an option on the table, and that's how I'm going to be about it. And if anybody thinks that, trans kids are disposable, stay mad. We're not going anywhere.
Thank you so very much, Amaretto.
I think Randolph wants to come back in.
That's right. We got Randolph, and thank you so very much, Amaretto. Digging the glass. Woo. We are having an interesting conversation tonight. Randolph, I hope you had a good time. Where can people find you? And when it comes to transgender children having access to puberty blockers, what are your final thoughts?
Well, thank you for having me. I must have. I was away when you called me earlier. I'm sorry about that.
You're good.
I usually let you know in the private chat. I don't know why the message didn't come through this time. I think one of the key fundamental points here is, and I've said this before, is that a person has a desire to live honestly as who they really feel they are. And it's important that that they have that right, and we have the medical technology as a species to facilitate that. So definitely, and to do it safely. So of course, it's to me, it shouldn't even be a question. So I'm glad that you debated it today. I feel that you did well with it, and so Amaretto made all the wonderful technical points here. I'll just defer to that because I think that was excellent. So yeah, and people, if you to find me, my YouTube channel is at youtube.com/Randolph Richardson, and that's Randolph spelled Randolf. I founded the Canadian Atheists a few years ago to advance and help protect atheists from, I guess, a legal standpoint and whatnot. Is an organization I started a few years ago. So, sorry, I'm getting a little tired. I might be repeating myself here. The website for that is at www.canadianatheists.ca. We're a national organization. We're promoting atheism as just people, a demographic of people who don't believe in deities. We're also on a campaign promoting the normalization of atheism to help in one of our mandates to counter the vilification of atheists and the stigmatization of atheism, which is, of course, a ridiculous construct to say there's a stigma there. There is no stigma. This is normal. So the normalization of atheism campaign, you can read more about it at www.normalizeatheism.ca. We're taking a gentle and non-confrontational approach and asking for people to do less in order for it to be more beneficial to everyone in society. And there's also the True North Talk program, which is another project with Canadian Atheists that Neil and I will be co-hosting. It's a national call-in program. An atheism call-in program. You can read more about it at www.truenorthtalk.ca. Amy, thank you very much for hosting this. This was, I think, a very important, a particularly important conversation that's worth highlighting on your YouTube channel and putting in a special playlist, perhaps, of some of the more important topics. If you haven't already set up such a playlist, I suggest you do so. But of course, it's up to you. It's your channel. And a special thank you to the audience for tuning in, and to everyone in the audience, and to everyone on the panel today. I really enjoyed the conversation. Thank you very much.
Thank you so
Randolph.
very much, Randolph.
Always great
And
to
I
have you on.
agree. I think it's important to have these conversations, even when they're hard. In fact, sometimes those are probably the conversations you actually need to have. And all right,
Absolutely.
we're moving along. James,
Here we go.
we're flying the plane down.
It's
I'm
almost
handing it
over.
over to you.
All right. Well, wow, what a good conversation. I want to thank everybody for coming on, participating. Amy, good job in the debate. I think you did very well, and I think we got to hash out the issues pretty good tonight. So, these are complicated issues, and they're reasonable. People can disagree, but as long as we want to help the most number of people and we keep that focus, I think we'll keep moving in the right direction. So thanks, guys, for being a part of it, and we'll be back in a couple days. Yeah, probably not tomorrow, but the day after. Yeah.
Excellent.
Woohoo! Thank you so Thank you so very much, James. And yeah, it was an interesting debate. And I think, like Randolph said, these are important conversations. So I'm glad that they're immersed in the culture. They are the zeitgeist of what we're talking about. And all right, everybody.
Very complicated stuff.
With that, I hope you all had a good night on tonight's episode of Midnight Ranting.
Someone's behind you,
Should
Amy.
trans children. Is there someone behind me? Dun dun dun.
Castle Doctrine. Castle Doctrine.
I think she's non-binary. Be careful.
Well,
Be careful.
these special effects are great.
I
Amy.
am
You've
non-binary trans.
You've become
Special
so
effects are
masterful at
great.
this. That's amazing.
It's amazing what you can do, right? It's all that special effects money.
Smoke and
Smokey?
mirrors,
Is
but
he
you don't
back
seem
there?
to be smoking anything. So this is really impressive.
Exactly. And where we should trans children be allowed to take puberty blockers, where we all had a talk about the sensitive subject of gender dysphoria, pills, and parents trying to do the best they can. I want to thank my co-host, James W., with our guests, Ogre, Amaretto, Cerberus, Leophilius, Will, Marshall, Pat, Danny, and Randolph, along with all the lovely people watching with us in chat and our great mods who make things so great. Don't forget to like, follow, or subscribe. And if you'd like to support us making even more content, you can find our Patreon at patreon.com/Amy Newman. I'm Amy Newman, and we will see you all on the next episode of Skeptic Ball Z.
Mana.
Mana.